is transferring the object. So can you understand? So this is ideally this is a diplegic child, but the etiology is hydrocephalus.
Fish. There is a real weakness is there, right?
So child is transferring the objects. So can you understand? So this is ideally this is a diplegic child, but the etiology is hydrocephalus.
Fish. There is a real weakness is there. Right?
Shashin Kaushal, Shashin. Right? So if you're a small child, you got toy, right? You can break it. So yes, it also has been pigmented.
high art talent is there. Quantitatively, they concentrate because in your test sometimes you might get a murmur. You can see power is ready, you can see power is ready. So there is Baba, Mama, Sakuru Devi, Amma, Tata, Amma, Bala, when Jessica ranked one last time, they are giving a better message. That's very important. Another important message was she told, she didn't prefer illustrated or any other note or any other single book. That's another thing, right? Whenever you want to give under, whenever you want to keyword, that will be okay, right? You are rank one under.
Pediatrics D-Easy.
Look at those videos. Yes, amazing classes on VIVAs, like spot on. Like it makes you think. It tells you why you're doing what you're doing. So and by the time you go for exams, you will be super confident. It showcases like I was really confident. I was not even scared a bit, and I know what I was doing.
Emphasis practicals is key. You have to go through it. The mismatch practical, the short case practicals.
Study all the clinical examinations, what sir tells, and then just perform it. After following the theory and after going through all the clinical examinations step by step, I was able to still perform.
You can hear sir's voice in the background.
Pediatrics D-Easy.
Look at those videos. Yes, amazing classes on VIVAs, like spot on. Like it makes you think. It tells you why you're doing what you're doing. So and by the time you go for exams, you will be super confident. It showcases like I was really confident. I was not even scared a bit, and I know what I was doing.
Emphasis practicals is key. You have to go through it. The mismatch practical, the short case practicals.
Study all the clinical examinations, what sir tells, and then just perform it. After following the theory and after going through all the clinical examinations step by step, I was able to still perform.
You can hear sir's voice in the back of your head during the long case guiding you.
What I did was listen to him very carefully. Whatever the note, whatever the things he teaches, like
nothing much to study, there's nothing to read. Just follow sir's notes and just follow what sir has to tell, and you go for all the classes regularly. Then these exams are not difficult at all.
Don't read unnecessary things. Just stick to sir's notes.
because person to conduct this sophisticated classes, like he used to do light weighting and
serving guide you on very well in the short cases and the long cases, which is great advice. I mean, patient handling, the skills and the things I don't know, there was a lot much they gave to me, and I used each and every one of them.
So we had to practice in front of school.
I need to thank Dr. Ruwanka sir, because with sir, I had the personal opportunity to go and see all the cases. all the cases in the sense CVS more than 20 to 30 patients, CNS or everything, in thalassemia unit, everything, acromegaly, everything.
I went for sir's emergency line. So this previous exam where I got the case that I got was status at and it was the same case that I got for my VIVA in Jaffna.
All the questions you gave in class, word to word, those were the steps. Like in step by they asked all those questions.
I saw the patient from far and I told the diagnosis. Consultants were like shocked when I was like answering.
Sir will make you exceptionally good at it. Like sir made me like so much good at like everything I was doing. And I was so confident in my exam.
And pediatrics is easy.
Right. Very good morning, guys. Okay, great. So hope you all can see me. Hope you all can hear me very well. So can you please switch on your cameras? Right, great. So here, guys, very good morning, and hope you all are in a very related mood, right? So I got so many messages that you all have done the pediatric theory exams very well, right? Right. So after these SBA course, not unknown, and we didn't do like not to an but like you all were able to perform very well, no? So the exam paper was not like you were like everything, almost everything from SBA program, no? So most of the students have told me, right? I don't like you all will get through the exams, right? So PEDS, of course, you don't need to keep doubts. But unfortunately, last time, of course, a lot of students got failed in medicine. But I think this time, of course, a lot of students said that they were okay with the medicine paper as well. So, right, I hope I will be able to see you all even after the results. So one of the important messages, even if you pass or even if you get failed, it's always better to cover the VIVA whenever you get free time, because the thing is these SLNC now, not like those days, they are conducting these exams so frequently, so in a regular basis. So here the important thing is you will, like, if you wait till the very last moment, like if you wait to start classes after your results, or even like, then of course you might not have enough time. And the thing is, like, VIVA is always, you need to practice more and more. So more you practice, more you will be able to perform. So here, so it's always better to cover early as possible if you have time, right? So here the VIVA, the important message is, so right, just like, so just like the theory, even more than, like, you don't need to worry about VIVA as well, right? So if you follow my instructions, you don't need to keep a single doubt. You will definitely get through the exam. So I will 100% guarantee, right? So whether you are smart or even you are not smart, so you don't need to worry at all, right? You will definitely get through the exam. So, but the important message is you need to follow my instructions, right? So you will have enough time, right? So we have enough time, because like I'm like seeing like exams will be conducted on probably on these August. So you might think like you have very limited time, but the thing is, that's why one of the reason I'm giving the platform as well. So you can cover the things early as possible. So then we can do more and more hospital visits, practicals, and the exams. So that then you will get perfect, right? So hope you had a very clear idea. So we'll start today's class. I'm not going to take much time for the introduction and everything.
Then we'll move to the short cases, right? So we'll start the CV short cases, which is the most important lesson. So here the important message is, guys, what? The VIVA is, it's all about talking, right? So it's not like theory, right? So you need to be smart in talking. So these classes are also part of your training program, okay? So that's why I want you all to switch on your cameras and I want you all to participate actively. So you can make hundreds of mistakes here, but you can't make mistakes in your exams as well as when you come to LRH, right? So for practical, so you can't make any mistakes. So here we make sure like you get perfect here, right? So you can make hundreds of mistakes here, and then you can get perfect. So I want you to switch on your cameras. I want you to put your real names and also participate actively, right? So I saw a few names there, right? So double E, right? So put your correct name. Okay. So great. Please switch on your cameras. So here one of the important messages. I will put a small PowerPoint presentation about the VIVA plan. So then, of course, we will start the short cases, right? So here I will quickly tell you about the plan, right? What we are going to do. So if you find any doubts, always feel free to unmute and ask, right? So I don't need to actually explain about me, right? I'm Dr. Ruwanka. Actually, I started these classes when I started these classes when I was a pre-intern, right? Because I had the highest marks ever in history, even like the total mark as well as the each component separately. The SBA is highest, the MCQ is highest, SCQ is highest, short cases, long cases, everything, right? So you can check the documents are there from like 1996 Colombo faculty as well as other faculty and other faculties. You can check. So here one of the important. Then of course I did some postgraduate exams, but these qualifications are not the important thing, right? So there are enough qualified people are there in Sri Lanka. But the most of students, why they join my classes, the reason is because none of my students get failed in the exams. That is one reason, and I make everything super easy. So you will be able to understand everything and you can apply and you will not get failed in the exam, right? So that is the reason. So here the guys, regarding ERPM, you all are aware, this is an examination for registration to practice medicine in Sri Lanka for foreign qualified medical graduates to the health system in Sri Lanka. But the purpose, right? What is the purpose of conducting ERPM exam is we want to have good house officers to health system in Sri Lanka. Keep this in your mind, right? So we don't want nursing officers or attendants, or we don't want consultants, right? This is an exam to get good house officers to the health system in Sri Lanka. So we assess whether you have enough knowledge, right, to become a very good house officer. That's all, right? So that's why we always ask about common things. And we always want to pass y'all, because at the moment we are in a huge crisis. So we try to pass y'all as much as possible, right? So that's why, like, if you perform a little bit even, we will pass y'all, right? Unless you never get failed, unless you are extremely weak, right? So keep that in your mind, both theory and VIVA. So we always want to pass y'all, right? So keep that in your mind. So if you have proper theory knowledge, good theory knowledge, and if you can apply, so you will get through the exams. So in your exams, guys, what do they actually expect from you all? Or do they really assess? So one of the important thing is, guys, what? So they assess the core knowledge of clinical facts related to common conditions in Sri Lankan hospital setup, right? Common conditions. So do we ask about metabolic diseases? There are thousands of things are there in pediatrics, right? but we always ask about the very, very, very most common conditions, right? And very obvious, easy ones, right? So most of the time you will, in your exams, most of the time you will get a side febrile convulsion, asthma, right? There may be nephrotic syndrome, UTI, something like that. Very common things, right? We never ask rare things, right? So keep that in your mind, right? So then, of course, we assess the clinical reasoning and the critical thinking and decision making. So those things will, right? So that is, again, we will assess that part and also the patient care as well, right? So here the important message is, guys, so you hope you all have an idea about the VIVA structure. So you have two components, the part B and the part C. So the part B will carry the medical track and the surgical track, which includes medical track includes both medicine and VIVA, or medicine and PEDS. And in part B VIVA component, you get long case as well as short case. So the long cases, of course, you will get 20 minutes where you will get one long case where you will get 20 minutes and where you need to take the history within 10 minutes and make the summary and everything within 10 minutes. And so the discussion, again, it will be 10 minutes, right? So then when it comes to the presentation and the discussion, it's 10 minutes. So when it comes to short cases, so there will be several stations will be there, but you will be getting only 2 cases. So for one case, you will get 10 minutes. So where you need to do the examination and everything within 7 minutes, and the presentation and discussion, you need to finish within 3 minutes time, right? So when it comes to the parts, it's always about the emergencies. So we don't ask much about, don't think that we will give you these equipments and the procedures, except in neonatal resuscitation and very few things. So we always ask about the emergencies in your medical track. I'm not talking about surgical track, right? So when it comes to the medical track, so emergencies, again, you will get only 10 minutes for both medicine and PEDS. So they will give a case scenario and you need to identify the case and you need to tell about the emergency management. So you will have a clear idea when we join the course and when you follow it. So here the guys, regarding pediatrics ERPM structure, so the part B, so you need to score very high marks. So even though like we say long cases, you need to score minimum of 45, short cases minimum of 45, and the total average of 50. So always try to score more than 80, right? So because the thing is, if you can score more than 65 in my exams, so you don't need to be a single doubt. Definitely you will get through the exams in your real exams. Because guys, even some examiners can be very strict. Some patients, right, they might not be very cooperative. And sometimes the case can be little bit complicated and difficult. The patient might not express, might not tell the answers properly, right, for your questions. So then, of course, even you find some difficulties in your exams, still you will be able to perform very well if you target to score more than 65, right? So try to score much as possible in when you're practicing with me. So then you will be able to score more than 45 in your exams. You will never ever get failed in your exams, right? What we have seen is most of the time students actually they get failed because they have very minute knowledge, right? So if you have at least average knowledge, you will definitely get through the exam. So the part C also, it's about the pediatric emergency and the medicine emergencies. You will understand, right, when you join the course. So the guys, the common myths related to ERPM exams are, so one of your seniors are telling around, oh, the VIVA is so difficult. VIVA, part B and part C are very difficult, right? It's not true, right? Why we are giving almost like most of the time the CVS case and an abdomen or CNS, you could have given a miscellaneous commonly, right? In your short case, even we give CVS, right? We always try to give either VSD or TOF. If it is an GI abdominal case, we always try to give something like thalassemia or something like that. IMN, right? So very obvious, easy cases we are giving, right? So we always want to pass y'all. So exams are so easy, right? We give marks, right? Like unless you are extremely weak, you will definitely get through the exams. So one of the important messages, guys, last time, those who joined for my long cases exams, all the students got through in the exams. None of my students got failed in the ERPM pediatrics VIVA, right? Home pediatric pass. So if you follow the things, just like I am telling you what you need to do. So if you follow my instructions, definitely you will get through the exam. So if you join this, because the long case exam is very important, because I will, like, even if you score a little bit less in your exams, I will pick up those weak students and I'm giving an extra support, and I make sure like everyone get through the exams, right? Even the student who had the lowest marks last time, one student I gave only 5 marks. She also got through the exams, right? That's why I'm telling you all, because like I'm giving a training where you can definitely, if you study, you will be able to score 90s, right? So even if you are weak, you will be able to pass the exams without any doubts. So guys, so the other important message is, guys, what? So students, most of your seniors are telling that you get failed because you are weak in clinicals, or because you had less clinical exposure during your faculty time. That is the biggest lie they give, right? So the lot of previous students also will tell you all. So these hospital visits, right, or these too many practicals and going to hospitals will not change anything, right? Most of the students actually, they go to hospitals, they examine the patient, they do these examination and those things very frequently, but still they get failed in the exams. Why? What is the reason? Because, guys, we fail students because when they are not telling their facts and these answers rational, right? We want rational answers. So as I mentioned, told you all, so we are giving most common cases. So the CVS, we give short cases, either VSD or TOP, most of the time, almost always. Then CNA, something like CP. Then the abdomen, we give something like thalassemia most of the time, right? Why then students get failed? Even long cases, we give either febrile convulsion, asthma, something very common case. So still students get failed. What is the reason? Guys, because students are not giving correct answers. Like there are expectations are there, right? Because so students are not giving the complete proper answers. That is the reason so students get failed. So that's why the most important thing is covering the lectures, and make sure you are very perfect in those lectures, right? Those facts. So then of course you will get perfect. So even if you practice with dummies, right, you will, even if you don't examine a single patient, still you will get through the exams. One of the best example is, guys, so during the COVID pandemic, right, some students are very scared to come to hospitals and practice, right, at that time. But significant number of students got, right, they all got through if they have followed these lectures, right? So one of the most important things, follow these lectures, even if you don't go to a single hospital visit, so still you will be able to get through the exam. That is the reality. So I'm telling you all, with I've been in this field for more than 8 years, right? So I'm well aware because I started these things when I was a pre-intern, right? Even before my internship. So this is the reality, right? So don't think that hospital visits will change anything or practicals will change anything if you don't cover the theory, right, related to these VIVA, right? Okay, VIVA related theory facts. If you cover that, you will definitely get through the exam. So here one of the important messages, guys. Even like very recently, one of the students gave me a call. So I don't know whether he might hear also. So he told whether he can join the hospital, whether he can come to LRS to practice. So then I said, like, join this free introductory session, and then you can follow my lectures, and once you get perfect, you can come to LRH and practice with me. So he said, like, sir, I did VIVA once and I got repeated, and I thought of joining the practicals right now. So then, of course, I said, no, it is not possible. So last time, like, none of my students, I know who got failed. There were only 2, and they also didn't join these VIVA exams or anything, and they didn't practice a single case with me. So I am well aware who got failed, and so I don't think like you joined. Then he said, yes, sir, I did the self-study. Right, so some people, right, and some people try to do self-studying and they just go to the practicals. They think they have connections with other consultants and they go to hospitals and they practice. No, that will not change anything. That will might cause more harm than the good, right? So if you get hacks from everywhere, and like thing is, various people might say various things. And the thing is, guys, if you go to some, like the thing is, if you have gone to some other class, sometimes it is very difficult to, right? Like, because we need to erase everything and we need to, I need to take all y'all to the correct track, right? So it is more difficult. So because guys, if you keep on practicing the wrong things, so it is more difficult. So that's why I always tell y'all not to read a single book, not to go to any other class, not to watch a single YouTube video, right? And just follow what I say and just practice my instructions, then you will get through the exam, right? It is easy, right? Don't read a single book, don't read, right? So keep that in your mind. So because I know what is the best, and if you follow that, you will definitely get through the exams. So then finally students get failed because they were unlucky during the exams. Lamai, no, there is nothing. Some students, they say like examiners were tough. Say, mata hambune kharab hidiye, mata hambeccha examiners la hari naha, right? Mata hambeccha patient hari naha. No. Don't blame patients. Don't blame examiners. It's all about you, right? It's all about you. Whatever the subject, if you get failed in whatever the subject, that is all about you, right? So the thing is, guys, mage lamai fail and mage instructions follow karapu ek lamai kar. No, that will never happen, right? So that's why I'm telling you all, it's always about you, not about the examiner or anybody. So follow the instructions, then you will definitely get through the exam. So the guys, the pediatric VIVA course plan this time, right? So part B, so we are conducting short cases, classes and practicals, long cases, classes and practicals, and the emergency classes and practicals and exams, right? So the short cases, guys, so here so you might think why I am starting with short cases. So here the important message is, guys, the main reason is, so these short cases and the both long cases are important. The long cases, for which fact, like thing is, of course, there is in the long cases, of course, there's a history component. Then, of course, you need to do the presentation. You need to present the case, then or a summary. Then, of course, there will be a discussion. But the thing is, guys, in long cases, or most of the time, we give marks or the most crucial fact, or the fact that which decide whether you are going to pass or fail is the discussion. So if you have very good knowledge, right, in your theory, so you don't get failed in your long cases, right? So you will definitely get, right? You don't get failed in long cases. But so I don't know whether you have a very good theory knowledge, but if you have joined my theory previously, then of course you can sit for the long cases even tomorrow, right? But even if you haven't joined my long cases, don't worry. If you follow the long cases classes, you can score 90s, right? You don't need to keep a single doubt. So the long cases, of course, like since you have a little bit tired, since you have done theory, since you are very fresh or just after your theory exams, right? So you will be able to perform a little bit. For the short cases, it is very new, right? So the examination, the discussion, the thinking about DDs, yeah, we didn't discuss those things in our theory at all, right? So the short cases is something very new. So that's the main reason why I start short cases. At the same time, guys, so if I cover the short cases, so you need to have a little bit more practice, right? With patients or with the dummy, right? In short cases, so we can start these practicals early, right? So we have hospital visits, we have these specialized unit practical, and we can start the mass mix practical, right? So we don't need to wait very last moment. So you can do more and more practicals. So then that's the reason I started short cases. But at the same time, we can't wait till we finish the long cases. We need to go almost parallelly. So it is it's important because the long cases is the main thing, right? Which decides whether you are going to pass the exams or not, the reality. So thing is, guys, long case is also important. So we need to go parallelly. Because like when you come to a hospital, we can't, like the long cases also you need to practice. At the same time, you can call me and you can practice the long cases, right? So you need to go parallelly, but I started short cases due to that reason, right? So once you're done with that, so we can move to the emergencies. But once we finish the short cases and long cases, it would be very easy to finish emergencies because most of the things you have covered in your long cases as well. So emergencies, of course, so the common emergencies are we ask how to manage the life-threatening asthma, or maybe management of status epilepsy, or something like management of diabetic ketoacidosis, right? So which I have covered even in your long cases as well. So if you have covered the long cases, it would be very easy to follow the emergencies as well as the thing is, but there are new things are there which we don't discuss under long cases. So for example, the croup, right, the snake bites, PCM poisoning, there are, right, a lot of topics are there. So, but it would be easy to cover emergencies after finishing long cases. So guys, right. So regarding short cases, guys, there are several things are there which I do to improve your knowledge and the capacity. So there are 6 things are there. So the first one is the online lectures. That is the most important thing, right? Where I conduct some classes live, but you can cover through platform and cover the things early as possible. I always advise you all to cover the fields early, because like if you get perfect in fields, like if you get smart in pediatric examination, you can do the medicine examination also easy. And also at the same time, so you can do more and more practicals, and you can come to the hospitals where, like as far as I know, like the GNOBs and some other subjects, there won't be any frequent practicals, and the examination is almost similar, right? There won't be much variation in GNOBs and some other subjects. So, but pediatrics, there isn't huge variation is there. So try to cover the online lectures early as possible, early. And it will be 24/7 platform is available, cover the things, and you can practice with me, right? So then of course, I'm conducting online practical revisions and exams. Guys, this is extremely important, right? Because like I am giving you all targets. So if I just ask you all to finish, you will never cover. So I'm giving you all targets, and I make sure, so the thing is, once you cover those things, after covering those things, I'm conducting some exams online where I'm giving videos and these pictures and videos, and I ask students to write these lateral questions. Just like the exams, I ask questions, and the advanced ones, how do you like think, how do you like come to the conclusions, how do you by what are your DDs, right? So there are so many things are there that is extremely important, right? So after online lectures, the next important thing is online practical revisions and exams. So once you after that, you will have an idea whether you are confident, whether you have enough knowledge, right? Whether you can go to hospitals and practice, right? So you can have a very clear idea. So then I'm conducting some specialized unit practicals where I'm conducting CNS and CVs. And also at LRH, there are specialized units are there. So the cardiac, right? And these other specialized units, right? So where you can practice, right? So that is important. Then when you finally the hospital general pediatric wards visits, so one of the important messages, guys, those days, of course, I allow students to just come and practice. So then what I noticed was every day I need to teach. The students will be in the same place. Then of course, like last 2 years, I changed the pattern where if you are coming to hospital, you need to be perfect in your theory facts related to these VIVA, right? And you need to be very perfect, and only my students are allowed to join. So if you if you have studied, you can come and you can, it will be just like the exam. So I will be giving short cases and maybe long, and also long cases, and I will be timing, and one student might record. So then you can again video and you can again see your mistakes, right? So then of course we can have the discussion just like the exam, and you will be perfect, right? So that is the important thing. Again, it is important. So try to cover the lectures and practicals, then you can come to the hospitals. So don't wait till the very last moment. Then of course you will not be able to practice with me, right, in the hospital setup. Then finally, the mass mix type practical sessions, guys. So where anyone can join, but I will be bringing the patients with all the classic science, because in my these data collection, right, all the patients are there, right, with the classic science. So some people say, like, there was a reason the complaint was there, I'm bringing exam patients, right? I'm not bringing exam patients, I'm bringing the patients with classic science. So they count for the exams, right? So I can't do anything because they get treatment from me as well, right? So right? So I'm bringing those patients. Sometimes, like, you might see, if you get a station around Ruwanka, Kalubowida, or LRH, right? Most of the time you will see the same patients, right? So it is very important, but these mass mix practical. So here the thing is, you will see everything, right? In mass mix practical, you will see everything, right? So all these serious cases, the abdominal cases, CNS cases, everything, right? The miscellaneous, development, neonatal, everything, right? So you will get 100%, you will see everything, and you can get perfect, right? So good. So this is some specialized unit practicals where I conducted, right? So again, this is again some other specialized unit. This is LRH cardio unit, right? So where students practiced and got perfect in murmurs, right? And these are some hospital visits, right? So general pediatric wards last time, right? And so again, the hospital visits, right? They are in Dampa, Japura, and Ragama, right? Previously. And these are pictures of mass mix practical, right? So you can, right? So hope you had an idea regarding short cases, right? So before moving to long cases, right, guys, do you have anything to ask? Great. If you have anything, you can ask. So guys, I think I told we will change the pattern. So the thing is, guys, I think you can have, I will ask 1 or 2 students to talk about their experiences. So then how do they studied, and some top rankers. So then of course you will have an idea how they studied and how it went and the reality and everything. So you will have an idea, right? So I think you have heard previously also. So this time I don't take much time. I will ask from maximum of 2 or 3 students, right? So who's there? Gayatri, are you there?
Yes, I'm here.
All right, great.
Shall I switch on my camera?
So, right. Okay. Can you switch on the camera? That would be great.
Yes, good morning.
So can you give a small introduction? Very good morning, Gayatri. Yes.
Good morning, sir. So I'm Gayatri Jayasurya, and I'm waiting for my internship this time. And so thank you very much, sir, for giving me this opportunity to share my experience with all of you. And so I first get introduced to sir through this pediatrics program, of course. And then I have to
So
thank
before I
sir.
start, before that, Gayatri, excuse me. So
Yes,
I will. She's the rank 2 last time merit list, right? So right, okay, go ahead.
Yeah. So I first get introduced to sir through this PAEDIATRICS program, and I'm so grateful to you, sir, for making our lives so much easier. I remember I could revise the entire pediatric syllabus within like 2-3 hours, and I was so prepared before I went for the exam. And then I actually meet sir in person when I went for the practical sessions and the hospital visits. And it was so easy for us to warm up to him. You all will see what I'm saying. He's such a kind-hearted, friendly person. And most importantly, I have to say, the hands-on experience and the opportunity to perform in front of sir helped me so much for my exams. And I have to say that what helped me the most was sir used to give us targets, and he used to tell us specific short cases and long cases for us to prepare beforehand before we go for a practical or a hospital visit. So each practical or a hospital visit was kind of like a mini exam for us. So we used to prepare very well and then go and perform in front of sir. So by the time we got to the exam, we were fully prepared. So make sure that you all get the maximum use of that opportunity. And I remember when I went for the exam, the first short case that I practiced with sir was developmental assessment, and that was the exact same thing that I got during my exam. I remember calling sir and telling also. And I have to say, you all don't have to study anything extra. Just stick to sir's notes. You all don't. If anything extra is really unnecessary, because sir gives you exactly what you have to study for the exam. And make sure that you stick to the concepts and study everything and do exactly as sir says. Sir has a beautiful, it's really nicely organized, the practicals and the exams. So make sure that you all do exactly as sir says, and make sure that you all practice and perform in front of sir. I remember while doing my long case, there was nothing that I didn't know, because everything kept coming because I have practiced with sir and because of the tudes. And make sure that you stick to the concepts and stick to the tude and stick to what sir says. And I don't think anything will go wrong during the exam. For me, I got the exam within 6 days after I got the date. So, and I had 3 subjects on one day. But then I did not panic at all for pediatrics, because I had performed and practiced with sir. And also because of sir's mass mix practicals and the hospital visits, by the time we go to the exam, we have seen almost all the patients. And the exposure is so immense. I don't think you all will get that exposure from anywhere else. So make sure that you take that opportunity and get the maximum use. And I'm truly grateful to you, sir. Good luck, everyone. All the very best. Thank you, sir.
Thanks, Gayatri, and she's from Vitebs University, and she got ranked, so I'm really happy about that. But so one of the important thing is, like, I can't take the credit everything, because like within first 15, I think except 2 students, I think all actually joined my classes. But here the thing is, I can't take the credit, because it's all about 7 subjects now. So here the thing is, but anyway, I'm happy about Gayatri, and it's one of the most important thing is whether you're like even the most weak student in your university, whether he or she has got through the exams, right?
Yeah.
Of course. So then, of course, regarding this, what Gayatri said, right? So the one of them I can remember. So Gayatri came to Gampaha Hospital. At that time, I was working at Gampaha Hospital. So DGH Gampaha. So I can remember I gave her the developmental assessment, and she was able to practice, and I was able to correct those mistakes. And I think you saw those pictures also in the previous slides, right? So she was practicing. So doing the developmental assessment with me. The same case she got in the exams, because most of students, they don't study and get perfect in development. Right, because like, and it is bit difficult. Development is one of the difficult case where like it is difficult to perform straight away at the exam, right? Because like, and they won't be any overlap from medicine as well as like nothing. And again, because like it always depends on the child's behavior and everything. There are so much to like, so many practical points are there, right? So I think I was able to correct those mistakes, and Gayatri was lucky. And the one of the important thing is, I think she had a very good trust and faith, right? So then so she got the same case in her exams, right? So
I remember, sir, before the exam, before for each and every exam station, you used to tell what we should study. Not everything. Like, I trusted you so much. I just studied that and went for the exam, and I got exactly the same things.
So just before the exams, I separately divide into stations, and I put messages also. But you need to exactly study and everything. So right. So wishing you all the best, Gayatri, and definitely, I don't know whether you will do pediatrics for your postgraduates, but definitely I'm sure you will be a very good, kind-hearted doctor, and wishing you all the best, Gayatri.
Thank you very much, sir. Thank you.
Okay. Do we have someone like Vinura? Are you there? Yes. Can you?
Yes, sir.
Can you give a small introduction about yourself and?
Yeah. Good morning, sir, and good morning, everyone. Yes, I'm from Manipal. I'm also waiting for internship this time, and yeah, so I also got to know sir through PAEDIATRICS, which I think you all know is very helpful for the theory part. So yeah, so for VIVA, obviously, like I had to go with sir because like I was like very confident in his teaching, from having to know him from the PAEDIATRICS. And so as far as VIVA is concerned, I think his VIVA course is actually, like, in my opinion, like even better than PAEDIATRICS, because like if you see the pass rates, I think like it shows for itself. And like the fact that he's like very well organized, and like if you take the short cases, like and the long case also, like if you take the history taking format, like it's very well organized. So like you won't miss a single point in history taking. And also you can use the same format for other subjects as well. I realized that doing like pediatrics, like it helped me to get through the other subjects as well, because like the confidence you get from following sir's methods, you can apply that to other subjects as well. And same with the short case course, like the examination parts, like it's like so methodical, and you go step by step. You won't miss a single find. And yeah, like and also I encourage everyone to attend his live classes, like he mentioned earlier, because like the interactions you have with him in the live classes, I think like that's very important, rather than just watching like videos, because like you can learn stuff and he'll ask you questions like out like the middle, and you tend to remember things more, and it helps you build your confidence up also. Yeah, so I made sure to attend like most of his, like almost all of his live classes. And also like his maths mixed practicals, like you get to see like he mentioned before, you get to see like almost like all the cases that you'll get in the actual exam. And like performing in front of sir and in front of a crowd, like if you're a nervous person, it'll really help you like build your confidence up. And so when it comes to the actual exam, like you feel like it's nothing basically. And like yeah, I remember another thing, like he had this online class right before the long case, where he discussed like all the cases that we can potentially get in the exam. And I think everyone in that class got like the exact same case that he discussed, like everything, like from the discussion, everything that the lecturer asked, like he basically covered in that class. Like it was almost like sir was asking those questions. So I've never felt like that confident after a long case that I felt with teach, because like basically everything that the lecturer can ask, like sir will cover in the class. So yeah, like I didn't study anything other than his notes as well. I think if you study his notes, like that's more than enough to not only pass, but to like to get good grades also. So like yeah, I mean, like I think I have nothing but good to say about sir. I mean, like I think he's like, as far as the teacher is concerned, like he really knows how to teach, like not only the knowledge, but like how he applies his teaching so that he gets the best out of everyone. Like that's what I found was special. And yeah, I think sir is one of the best I bet. Yeah.
Thank you very much, Binura. And
Thank you.
you're from Manipal, Malaysia. Am I correct?
Yes, sir.
Yes, and your rank is 7.
Yes, sir.
No? Yes. So here the Binura was a very good student, and I don't know whether your girlfriend told, like again she also got the same, like she practiced one case just before the exam date, and she got the same case.
Yeah. Yes, I think a lot of people in that class got like the same case that you discussed.
Case, yeah,
Yeah.
that happens, right? Same
Yeah.
case they practice. Okay, so because like if you have faith and like because like with our experience we can guess, right? So and most of the time you will get the same case to practice, right? So good, that is great. That's the great. So thank you very much, Binura, and
Thank you, sir.
I'm pretty sure you will be a very good doctor, and right, you are very smart. You will be a smart and handsome, and right, most of the patients will like you, right? If you do pediatrics, most of the mothers will like you for sure, right? So then, so wishing you all the best, Binura. So
thank you,
thank you very much for joining, and
thank you.
I will ask one more student to tell their experience. I don't want to take much time because right. So Salma, you're there, no?
Yes, sir. I'm here.
Yes. Yeah.
Okay. Good morning, sir. Good morning, everyone. So I'm Salma, and I'm from IMU Malaysia. So I'm currently done with ERPM and waiting for my internship. So today I'll just speak briefly about my honest and first-hand experience of Ruwanka's classes and how it benefited me. So to be honest, I only got to know about sir once I was done with university. And in the time I've known sir, he has become one of my best teachers yet. So one thing I like about sir is he does not focus and prioritize only bright students. He has the ability to make the weakest of students bright too. So he instills a sense of confidence, which makes you feel you can pass any subject because the concepts he teaches, you can apply to other subjects also. And sir shares his valuable personal experiences, which comes in handy in situations you can't even imagine. So he makes difficult concepts very easy. Personally, for me, his PAEDIATRICS was a miraculous course because due to the limited time I had just about 1 or 2 weeks. So I studied only that and mastered the concepts. So sir's theory and notes is enough for you to pass. So because it is structured in such a very simplistic and very easy to understand and remember approach that you can't go wrong. So if you've noticed how sir's PAEDIATRICS are structured, sir's VIVA classes are phenomenal. So it's very systematic and his classes are well structured. So, and you can apply the concepts, for example, history taking, summarizing, everything you can apply to other subjects and you can impress your the examiners also. So, sir teaches just the right amount of things you need to know, not too much, not too less, just the right amount. So, for example, in my emergency vivas, I was given an uncommon case and I still managed to answer all the lateral questions also without hesitation because sir had taught me. And similarly, in my mass mix practicals, I found extremely important because during my short case pediatrics viva, I got developmental milestones. And like sir said, that's an area which most of us don't really cover. So I could remember how sir approached the kid, how sir interacted with the child, and I used my PAEDIATRICS knowledge, and I was able to perform in my pediatric short case vivas. Another thing is sir does not leave you at the last moment. So I remember like he makes sure you reach your fullest potential because I remember sir calling me on his way to work despite his busy schedule and practicing long cases with me. So he makes the extra effort. And it turned out I got the same exact case which sir discussed with me. So, so I would say go with the mindset that you can tackle any case thrown at you because just master the concepts. That's it. And one thing sir always says and emphasizes is to have trust in him and in your effort and preparation. So you can't go wrong. I trusted him and achieved my goal. So now it's your turn. Thank you, sir, for everything.
Thank you very much, Salma. So I can remember like just before the exam date, no, I actually like discuss a case with you. And that time actually I said like that the amount the answers what you gave was not enough, so I taught these some facts, no? So then next day you got the same long case,
Yes, sir.
which you practice over the phone, right? So just before the exam day. So here the thing is, Salma is one of my very best student, one of my favorite, and so I'm really happy and wishing you all the best, Salma, and so always be a generous and a kind-hearted good doctor. So my blessings are always with you all. So then, so thank you very much, Salma, for sharing your experiences.
Thank you, sir.
Okay, guys. So I don't want to take much time, guys. So hope you had an idea, because like Mamma Kila Hariyannet nahan is right. The students need to tell their personal experiences, because like how they felt and like how they study, how they did, right? So here the thing is all they all were able to come within first 10, and so that is happy. But as I'm telling you all, you need to follow the students, like not these very smart students. Right? When a පන්තිකට ගියත් ඉතින් සමහර කොහෙට ගියත් සමහර ගොඩක් වෙලේ pass and chance එක තියෙනවා, but anyway I calculated them properly because pediatrics is not so easy. But so always look whether like who are the weak students, කවුද දුර්වලම ළම, ඒ කට්ටියත් pass වෙලා තියෙනවා. Then yes, right? So that is the most important message, right? ගොඩක් අය රැල්ලට smart ම එක්කෙනාවනේ follow කරන්නේ, right? That is there. So any is a very bright student. That is also a bright student. This is also a bright student, right? So they are bright. They got a bright කවුරු හරි කියනවා නම් මම මෙතන එච්චර bright නෑ කියලා. ඒත් pass වෙන්න පුළුවන් කියන එක තමයි වැදගත් message එක. මොකද weakම කෙනෙක්ව ගත්තත් මම මෙතනට අද කතා කළේ නෑ. බෑ මම pass වෙනවා, right? So that is the important message. So hope you had an idea. Thank you all for joining and sharing your experiences. So I will quickly tell you all about the long cases plan also. So I don't take much time for that. So here the thing is, guys, so second. So here the thing is, this is just some, you will see the, right? So here we are, right? Okay. So these are the practice. So you can see this is as Gayatri mentioned. So this is where she practices these developmental assessment with me. Developmental assessment practice. So she got the same case, right, in her exams also, right? So right, good. So we'll move to the long cases plan, right? So the thing is, guys, here long cases, again there are long cases lectures are there, and I'm doing a separate several live updates also, because time to time there can be few updates. For example, necrotic, the drug regime has recently changed. Now there's a dengue new guideline is there, but there are no much differences, and most of the consultants are also sometimes not aware about the very new updates, right? So even you say the previous ones, nothing, you will not lose a single mark, right? So but I will but you need to update before these intern and everything. So I am doing some live updated lectures as well. But there are online lectures are there. Yeah, you can cover the things very quickly, and you can practice with me. So here the important message is, guys, what? So I have given opportunity to students to every day practice, like I'm giving like nearly 1 hour to practice with me, right? So every day you can call me and you can practice 1 or 2 long cases, right? So more you practice, more you develop the confidence, right? So over the phone you can practice. So usually when they message me previously, I give a time. So don't wait till the very last moment, because the last moment all the students are trying to approach me, but it is difficult. So try to start early as possible. So then once you cover that, you practice with me long cases, right? So over the phone, and you get perfect, right? So every day you will get nearly 1 hour. So like 2 or 3 students will be able to practice, like, right, 2 or 3 cases, right, each day. So that is so try to cover these online lectures early as possible. So then, guys, we are moving to this online long cases training, where I'm conducting some long cases exams, sometimes online, right? So again, it is also important. So whenever I'm conducting, try to join. So then, of course, guys, the hospital visits. So when you come to the general pediatric course, so you can practice long cases with me, just like the exam. So we will give you 10, like, yeah, put in the stopwatch. So you can take the history within that 10 minutes time, and we are moving to the discussion. So it will be just like the exams. So you can perform and you can make sure whether you have got perfect. So finally, the most important, this is like after the online lectures, the most important thing is long cases live exams, right? So that is important. If you have whatever the knowledge you have regarding related to short cases, right? Whatever it is, if you get through the long cases live exams in front with me, definitely you will get through pediatrics VIVA exams. Hari saralai. ඔයා lectures ටික cover කරාද ඔයා long case exam එකට එන්න තියෙන්නේ. ඔයා වෙන මොකේකටවත් ආව ඕනේ නැතා මට එච්චර ලොකු issue එකකුත් නෙමෙයි. If you come to this, right? So and if you score more than like 65, definitely you will get through. Even if you score more than 50, with little bit, I will give some special little bit more training. So you will definitely get through the exams. Even if you score less than 50 also, I will train you all and I will make sure you get through the exams. So that is more very important. So join these live long cases exams, right? That is important. So these are long cases where, right, this is at Ragama, this is at Japura, right, where I conducted these exams, right? You need to, right, perform. So finally, the emergency exams. So I'm conducting like you can cover through online, right? So you can cover these lectures early. And finally, we are doing these live exams, practicals and updates. So the live exams, right? So this is at Japura, Ragama, Japura, and this is at LRH, right? These species setup. So here, bringing all these equipments and, right, doing these, showing those things at the same time. It is mainly about the it's like an exam, right? So there will be 2 examiners will be there, and you need to we are giving marks just like the exams. So you need to, if you pass in this emergency VIVA, or even if you get failed, if you join this emergency VIVA, definitely you will get through the exams, because I will be able to catch the weak students and I will be able to give some extra support if you join these emergency VIVA and whatever the emergency VIVA or long cases exam. Good. So guys, after everything, all the students, like after these exams, all the students are really happy about PEDS, right? What I have seen is even more than whatever the subjects. The students really get attached with me, right? They actually, like, they really love me, right? So because like after this VIVA, not like the theory, right? So because you actively involved. So after that, like, right, so since after the exams you all will be very happy. So these are some pictures where the students give some party treats, right? So this is at Water's Edge, then this Kingsbury, Cinnamon Grand, right? So here the thing is, so you can see the Salma, Vinura, right, Gayatri, all are there. So because the important thing is, guys, because you all will really get attached, right, with me after right during this VIVA. So I'm really happy because I'm the main reason I conduct these classes. The main reason is because of the satisfaction. Because when the students are keep on telling me, sir, please don't stop the classes, please continue, right? That is the main reason why I conduct these continuing these classes, right? Because it's not easy to balance everything, right? But that is the main reason. So here the reality, guys, so the pediatrics exams are really easy, and the pediatrics is easy, and you will feel that once you, right? So these are some students during they are enjoying their internship, right? So most of y'all will want to do PEDS for your internship, right? Whether you like it or not, most of y'all need to do PEDS for your internship. So make sure whether you got perfect knowledge, whether you get a perfect knowledge before your internship, and so everything will be easy, right? So life will be very easy, so you can enjoy, right? So not like the medicine. So medicine, of course, you are dealing with most of the time these something like that, no? So PEDS, of course, it's not like that. You are dealing with children, and it is a very nice environment, and it's right. You can enjoy. So you can enjoy your internship, right? Good. So right. So hope you had a very clear idea. So shall we start then? Okay. Hope you had a brief introduction regarding the plan. So so follow the instruction, and you will get through the exams. Good. So here the important message is, guys. So can you all take your notes? So I'm not discussing much about this introduction to short cases. It is there in the platform. You can cover. I will be quickly moving to this CVS short cases initial class. So then you will have an idea about the teaching and everything. Then you can decide whether you want to join the classes or not. And then, you can cover the things early as possible, and you can join these practicals. So here the important message is, guys, the CV, why I am doing CVS. So the CVS is the most important short case in your exams, right? So you need to get perfect, right? And that's why I'm starting with CVS. Once you're done with that, you can practice so many cases. So there will be enough patients in the hospital as well as you can go to specialized units and you can practice, right? So cover the CVS and make sure you get perfect. So there will be lectures, I will not be able to cover the entire CVS. The remaining you can cover through this platform, right? But I will be doing it. I will cover the significant amount, and the remaining you can cover through platform, and make sure you get perfect. So here the thing is, I'm teaching this session, so it's not really necessary to join my classes, right? My classes join in the. So you have seen the results, you have seen your seniors' experiences, you heard, and you have seen the results and everything, and you can decide, and you can have an idea a little bit about my teaching, and you can decide. So එක ළමයින්ට අල්ලන එක teachers ලා ඉන්නවා, right? But ඔයාට ගැලපෙන teacher ගාවට යන්න. මං ගාවට આવත් I will make sure like you definitely get through the teach. But ඔයාට ගැලපෙන්නේ නැහැ කියලා. If you think like not the correct person, so can like join whatever the class, and also you will be able to join to this mass mix practical, right? ඒකට එන්න පුළුවන්. Right, but not the other practicals or other, right? So that's how it goes. So then one level classes I can remember bio කරද්දී කෙනෙක්වත් හරියන්නේ නැහැ. මාරු කරනවා. ඉස්සෙකට විතර ගියා. එක්කෙනෙක්වත් හරියන්නේ නැහැ. අන්තිමට I went for some revision to the කියලා then එයා තමයි මට අල්ලපු එක්කෙනා. මටත් එක්ක තමයි මම ඊට පස්සේ කන්ටිනියු කරලා එක්සෑම්ස් පාස් වුණා. රයිට් ඉතින් එක එකට අල්ලනවා ඉන්නවා. ඔයගලන්ට සමහර වෙලාවට අල්ලන්නේ නැත්තම් ගැලපෙන කෙනෙක් ගාවට යන්න පුළුවන්. රයිට් ඔයගලන්ට කැමති විදිහට කරන්න පුළුවන්. රයිට් ඉතින් you but anyway you can like ඒක මම ප්‍රශ්නයක් නැහැ. like සමහර වෙලාවට ඔයගොල්ලෝ මගේ theory වාපු ළමෙක් වෙන්න පුළුවන්. theory තාවා you join for my MCQ-based topic-wise revision, the PAEDIATRICS program, everything. Right after that, also like you might do, like you can go to whatever the class you want. So like you need answer, right? Right? Okay. So it's up to you all. Good. Right. So guys, now I want y'all to take a good deep breath and I want y'all to concentrate. Right? Are you ready? Great. So this is all about VIVA. So thing is, guys, here about VIVA. So we are starting with short cases. So the short cases, there are the short cases. When we are doing a short case, guys, it is very important to have an idea for which component we are giving more marks, right? So guys, in your exams, of course, we are like we assess several things, right? So we will have a core idea and we will be giving the final mark, right? We are putting some comments and we are giving the final mark. But so for each and every component we are assessing and we are giving marks. So but here the important message is for some components we give like more and more marks, and if you have done well in those components, there's a high chance of getting through the exams. And if you're very weak in those these areas, right, there's a high risk of getting failed in the exams. So when we are giving marks, so we assess several things. So one of the important thing is, guys, we assess. First one is we assess the care, consideration, and the handling of the patient, right? So the care, consideration, and the handling of patient, right? So that is what, guys. So here the thing is, when you go to the shop, when you are performing short cases, so smiling with the patient, telling good morning, right? So then making sure like whether the mother and child is comfortable, giving a toy, right? With the bigger child, you ask for a screen, right? Then you gently examining the patient. So then finally readdressing the child, thanking the patient, right? So those things are important. We assess those things, right? Because most of the time we have an idea that foreign graduates right ඔය ගිහිල්ලා ආගියත් ඒගොල්ලෝ ලෙඩුන්ට ආද මේව නැහැ පුන්තන් අර අම්මලා සල්ලි වියදම් කරලා ආවිලා ඉන්නේ ඉඳා මේ ගම් මේවා කියලා. ඒ හින්දා specifically they assess that component as well, whether you are doing these things in a very gentle manner, right? So care, consideration, and the handling. So then the second one is, guys, what the technique and the order. So lamek පටන් ගත්තාම whether you are starting the general examination, then the precordium, right? Then precordium inspection, palpation, percussion, auscultation. That is the order. And the technique, of course, general examination, whether when you're assessing clubbing, whether you go to the same level, when you're assessing the hitting edema, whether you compress it 2 centimeters above the medial malleolus and keep it for 10 to 15 seconds. And you're palpating again and looking at the face at the same time, right? When it comes to these GI, whether you are palpating the liver in a very proper manner, whether you are percussing in a proper manner, right? When it comes to the RS, whether you are percussing in the 90 degrees, whether you are using this chest expansion nicely, the auscultation, whether you are giving the instructions and whether you are doing in a proper way. Then it comes to the CVS, right? So these are doing these palpating for the thrills, the palpating for the apex, right? Then these auscultation, right, areas, then the checking the CNS, checking the reflexes, right, in a correct manner, whether you are tapping in 90 degrees, right, and assessing the contraction of the muscles. So the technique, right? So there are so many things are there where we assess the technique. So that is the second part, the technique, and the order. The third important part is, guys, about the identification of the physical signs. So if the patient is having clubbing or fail, clubbing, moderate clubbing, right? So that is the assessing the clinical signs. Spleen is 2 centimeters below the left costal margin. Liver is 4 centimeters below the right costal margin. This patient is having a pan-systolic murmur or an ejection systolic murmur with a soft heart sound. Or whether this patient is having bilateral coarse crepitation in both inspiration and expiration. And there are a few rhonchi are there, and the crepitations are more prominent than the rhonchi. So the thing is that is about the detecting the clinical signs exactly, right? So this is, and these patients are having bilateral exaggerated reflexes and they with all the rest of the upper motor neuron signs, right? Those are the detecting the identification of the physical signs, physical signs, physical signs. Are you clear? So we are allocating marks for that as well. Then the fourth one is what? So the third one is physical signs identification, right? So the fourth one is, guys, what? So we are giving marks for the interpretation, right? So you were able to notice that the patient is having a pansystolic murmur and the left lower the left lower sternal edge. So what is the most likely diagnosis, so, right? So the child is having some sort of post facies as well as 2 centimeter liver as well as 1 centimeter spleen, right? So you are telling this is a beta thalassemia major who's a moderately chelated and transfused and not having any complications, right? So if a child with a for example, significant icteric child with a right hypochondrial scar. So you are finally, after interpreting everything, you are telling right. So this is a child with an diagnosed child with an biliary atresia who has undergone a Kasaya procedure and complicated with cholestasis and chronic cell liver disease and complicated with portal hypertension. I'm telling the complete right interpretation and the diagnosis. So interpreting properly and coming to the exact diagnosis or the conclusion, right? So then finally, the fifth one is the presentation of findings. So once you've done the examination, stethoscope you push, keep your chest up and you present nicely. Good morning, madam. I examine this 5-year-old child regarding abdominal system examination. This child is an active, well-looking child lying comfortably. Seems to be there is an obvious failure try, but I would like to check the growth parameters. This child is afebrile to touch. There is no obvious dysmorphic features. Child is afebrile to touch, not pale, not plethoric, and no signs of nutritional deficiencies, no finger clubbing or no peripheral stigmata of chronic cell liver disease. And there is no pigmentation over the skin or rashes, blah, 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 blah. The liver is palpable 2 centimeters below the right costal margin, which is firm, regular, and untender, and smooth surface. And the upper body was located in the 5th intercostal space. And the spleen is palpable 3 centimeters below the left costal margin, which is firm in consistency, regular margin, and smooth surface. And there is no any other palpable masses, blah, 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 blah. Right. So that is about presenting the findings with confidence, right? So that is about the presentation. So finally, the discussion. So the discussion is the last component where after doing everything, so they might ask few questions. So they might ask, so you said the patient is having upper motor neuron signs. So what are your differential diagnoses? So why do you think this is diplegic CP rather than quadriplegic CP? Okay, right. So you said like this child is having diplegic CP. So what is the most likely etiology? Right? Under discussion, right? So you said there is a moderate spleen and moderate size liver is there. So what are your differential diagnoses? Why you said thalassemia first rather than something like a hematological malignancy, right? So Nathan write something like there's a prominent bronchi and few crepitations are there. So why do you think this is bronchial asthma rather than bronchiolitis, right? So they might ask if you say like there is a bilateral post crepitations are there. So what are your differential diagnoses? So how are you going to differentiate the bronchiectasis from bronchopneumonia? Right? So those are the discussion, right? They might ask you questions, but it's not about the entire theory. The what is necessary will be like I will be teaching everything what is necessary. So here the thing is, guys, I told you we are giving marks for the care, consideration, and the handling, the technique and the order, then the identification of the physical signs, the interpretation of the physical signs, the presentation of the findings, and finally the discussion. So Shamil Iqbal, so can you please unmute? Right? Okay, yes, it's a friendly discussion, right? So tell me, I told you 6 components. Out of those 6 components, what do you think? For which component do we give? Which component or 2 components which we give more marks?
I think the interpretation of physical sign is like very important.
Okay.
That will reflect your knowledge about the disease.
Okay. So Udara Ishani. So can you please unmute and tell what do you think?
Interpretation of physical signs.
Okay. Okay, great. So very good. Right. Here this Udara Bandara. Udara Bandara. Any idea? Out of 6, what do you think? The care consideration and handling, the technique and order, the identification of physical signs, right? The interpretation, presentation, and the discussion. What do you think, Udara? I can't hear you, dear. Your microphone is not working, no? So, Yaganangi, Udari. So tell me, Udari Pascal, what do you think? Okay.
Identification of physical signs and interpretation. I think both will have higher marks.
Okay. So here the important message is, guys, most of the students, they think that it's about technique, right? And I'm happy that most of students were able to tell the correct one. So it is not about the technique, right? Care consideration handling, we give marks. Daru nalone ekatama neme api lakunu pedipurama denne. Technique, of course, right? It is very difficult to perform, right? In some children, for example, child with a bronchiolitis. So 6-month-old child with a bronchiolitis, how are you going to do this vocal resonance, right? The chest expansion. It's not easy. And going like if at a moment if a child cries, you will not be able to hear a single noise in during auscultation. So it is difficult. So you need to know a lot of tricks to how to handle. But the technique you need to do it in a correct way, but it is not the main one, right? So technique, right? Technique bus එකේ යන කොන්දොස්තරට පුළුවන් ඕගලන්ට වඩා සල්ලි කැල්කියුලේට් කරන්න. නේද? ටට්ටක් ගාලා මේව කරන්න. මම කියලා මේ මනුස්සයා knowledge එක තියනවා කියන්නේ නැහැ. So if you keep on practicing the same thing, right? එකම රටාවට ගියාම මේකෙන් වාගේ skill එකක් බලන්න නැහැ, right? So then the important thing is, guys, so the thing is the identification of the physical signs, and the interpretation of the physical signs. So you should be able to identify the physical signs correctly and the interpretation. So the identification is, guys, so clubbing tiyanawada nadda? Sure naha, dakke naha, miss una. Ehema bahe. Right? Cyanosis tiyanawada nadda? Liver එක අහු වෙනවද නැද්ද? Spleen එක අහු වෙනවද නැද්ද? Merm එක ඇහෙනවද නැද්ද? ඒක pansystolic ද, whether it is pansystolic or ejection systolic? Right? That is extremely important. That is the skill. Right? Now what is the main problem then by una? Ani sir මම liver එකක් ඇල්ලෙලම නැහැ. Spleen එකක් අල්ලලා නැහැ. Right? Merm එකක් ඇහිලම නැහැ. Guys, I will teach you what to do. So one of the important thing is, even if you go to hospitals, most of the time, like sometimes they might say, liver ekatti. Sometimes you might not be able to palpate that liver or spleen problem. When you go to hospitals, sometimes the patients might be there or in a clinic, right? They're with the merm, but you might not be able to hear. By when on the because those patients we will not bring in your exams. We always bring the most classic patients where the signs are very obvious and it is like merm එක පාරටත් ඇහෙන. ඒ වගේ. liver එක පත spleen පත liver. Right? So any student will be able to get that sign. Right, especially the main sign. Right, so you can practice with these. I'm giving some apps and everything. You can practice with those things, the auscultation findings. Then, guys, right? So when you in your exams, of course, you will be able to hear the pansystolic. You will be able to hear the ejection. Right, mass mixed practical, you will see all those patients, the patients with classic science. So thing is, guys, you will hear those things. So the hospital setup for when the health ministry you don't need to, right? If you practicing with the dummy and if you Google those signs and see some pictures, that would be enough. So the thing is, guys, that is extremely important, right? So you will be able to get the signs. Then the important message is, guys, the interpretation of the physical science. So the interpretation is the one of the main problem. What we like, the thing is, now I will ask a small question. Now, right? So here the important thing is, guys, the interpretation is the most important part. So if you can interpret it very rationally, right, you can tell some differential diagnoses, but if you tell in a correct order, right, so you will get the maximum mark. For example, guys, your main sign may be the massive liver with the moderate spleen, 5 centimeter size liver and the 2 centimeter size spleen. And in your general examination, you might see a deep picture with a dilated abdominal veins, caput medusae, distended abdomen little bit. And also there is a right hypochondrial scar is there. එතකොට ඔයා ගිහිලා මට abdomen නම් thalassemia කියලා thalassemia කිව්වොත් හරියනවද? You need to interpret it in a very rational way. So you can say this is a child with an ability of biliary atresia who has underwent an Kasaya procedure, who has and complicated with cholestasis, chronic cell liver disease with portal hypertension. Right? So what we have seen is practically most of the students get failed because they are giving incomplete and irrational answers. So when we ask, so the interpret what is finally we ask what is your conclusion. So most of the students used to say hepatosplenomegaly. That is a clinical finding. ඒක කිව්ව ගම fail. Then hari ළමයා මොකද්ද diagnosis? Then most of the time students used to say there is a hepatosplenomegaly, so can be a hemolytic anemia, can be a infective cause, can be a metabolic disease. මොහොම තමයි කොළඹ faculty පොතේ තියෙන්නේ. ඒ ගොඩක් වෙලාවට ඔයගොල්ලෝ සමහර medicine classes වල ඉගෙන ගන්න. Don't put those things in pizza or medicine වල හරියට diagnosis එක කිව්වේ නැත්තම් ලකුණු එන්නේ නැහැ. Right? So you need to tell the exact diagnosis. Right? Not like a hemolytic anemia. Hemolytic anemia, G6PD also is a hemolytic anemia. So do you get the spleen and the liver? No. You can't tell like that. Okay. So sometimes the students used to say thalassemia. So most of the time the case also will be thalassemia, but still they get failed. Why? Because the thing is, guys, the thalassemia, the commonest type is the beta thalassemia trait. So there they will not get the liver or spleen. Right, so if you are telling, you need to tell the complete answers. This is a beta thalassemia major who has been moderately, and depending on the size of the liver and spleen, you can comment about the amount of blood transfusion and the chelation they have received and associated complications. It's like that. So sometimes the students say VSD. So these are right congenital cyanotic heart disease, cyanotic heart disease, likely ventricular septal defect, and which has been complicated with pulmonary hypertension and heart failure, but not complicated with respiratory tract infection, infective endocarditis, arrhythmias of various types, and also there is an obvious identifiable etiology trisomy 20. Features even we give the commonest each case. So we want complete full answers. Otherwise, like cerebral palsy, till they get failed. Good after they fail in CP. So what's your diagnosis? Cerebral palsy. You need to tell whether it is a diplegic, quadriplegic, or hemiplegic, and what are the associated complications, right? Sometimes, like most of the time, students are unable to interpret, like tell the exact whether it is diplegic or quadriplegic. That is the reason students get failed in the exams. So that's why even how much hundreds, even if you examine hundreds of patients, you will not get through the exam. You don't cover the lectures, right? So cover the lectures, get the knowledge. සමහරව හිතනවා පීනන්න ඕන නම් වතුරට පයින්න ඕනේ කියලා. වතුරට පැන්නොත් මොකද වෙන්නේ? You will drown. So first of all, learn about the water. Size of deep end එක කොච්චරද 3 feet එක කොච්චරද. ඊට පස්සේ කොහොමද එළින් අත් දෙක මේවා කරන්නේ. ඊට පස්සේ කකුල් දෙක පොඩ්ඩක් බහැලා කකුල් දෙක කික් කරන්න පුරුදු. ඊට පස්සේ අත ගෙනියන්න try කරනවා. ඊට පස්සේ අතයි කකුලයි දෙකම ගෙනියනවා. ඊට පස්සේ තමයි ටික ටික මේ 3 feet එකේ පීනන්නේ. ඊට පස්සේ 5 feet එකේ. ඊට පස්සේ තමයි deep end එකට යන්නේ right යන්නේ. ඊට පස්සේ තමයි හිමිදිලා ගිහිලා deep end එකේ යට අල්ලන්නේ. right? නැතුව ගිහිලා බුක් ගාලා වතුරට දැම්මොත් ගිලෙනවා. ඉන්න මතක තියාගන්න ළමයි learn right in a very methodical way to cover the lectures, online these exams, join those things, then these the specialized unit practicals, the hospital visits, past units practical, the exam. So here the important message is, guys, since like there are like students are there, no, few students are there, no, even like they have covered previously. So if anyone wants, like after 2 weeks time, so you all can come to LRH, right? But make sure you have studied and you got perfect, right, before that. So you can practice just like the exams. There are enough patients are there, right? I am currently attached to LRH professorial unit where even the exams are conducted. But I don't involve in ERPM exams because it's not typical. So, but there are enough patients are there, right? You'll see everything. So here the important message is, guys, but I select the patients sometimes, right? But again, ERPM you can try. I'm try to avoid maximum. Local faculties now will be done. I think some other examiner data faculty, right? The cases selected right? Good. So here the important message is that. So make sure like you get perfect in finding identification of physical science and the interpretation. So here the important message is, guys, in your exams, there will be several stations will be there. So we might see 10 to 12 stations, but not in equal proportion. So stations can be CVS, CNS, abdomen, or then right CVS, CNS, abdomen, and respiratory system. So Tino, in addition to that, are there any more short cases where you can get in your exam?
Respiratory system.
Respiratory, CVS, CNS, abdomen, and respiratory. Then in addition to that, any idea? Short cases. So in your medicine also you will get the same. All those 4 systems are there. Not same, huh? Those 4 systems are there. Yes, then. Yes, Shamil.
Any rare cases like miscellaneous cases? Development?
Yeah, the development. Miscellaneous. Anything else?
GUT?
GUT. Not fire shot. Any idea? Anyone? Come on, guys.
Neonatal examination.
Neonatal examination. Neonatal examination, right? So you will get to all, yeah, you can get anything, right? So all 7 types are possible. But most of the time, the commonest is CVS. So the 70 to 80% of the students definitely will get at least one, like CVS short case will be there. Or CVS එකක් හම්බ වෙනවාම 80කට විතර 70කට 80කට විතර CVS stations එකක් හම්බ වෙනවා. එකක් CVS වෙන්න තියෙන chance එක ලොකුවට තියෙනවා. So you will get CVS. Then the next important thing is, guys, what? CNS and abdomen, some years and nowadays we give more abdominal cases compared to CNS because like what we have seen is ERPM students are performing extremely poor in CNS. That's why they have reduced the. So thing is those days CNS were more common. So it's almost equal, right? So the CNS is the next important thing. So that's why I'm doing next. Because the thing is, guys, most of the students, like they get, not my students, in general, most of students get failed because due to CNS, right? So, like, do the low limb examination. So, I think, cerebral palsy. What is the type? What is the type of set? Diplegic cerebral. How can you say diplegic? Weak tip. There's a weakness. Right? So you get most of the time you get failed. Sometimes there are like other CNS things are also there. You can get a high hydrocephalus, neural tube defect, muscular dystrophy, right, facial nerve palsy. So there are so many are there which you need to learn. But the thing is that even you get such, right? Most of students like to perform a little bit poor comparative. So that's why we are doing CNS next. So after covering these things, right, I will give you 2 weeks to cover that. Then of course I'm doing an online exam as well as at the same time this specialized unit, one specialized unit practical will be doing. So yeah, where you will see every like significant number of CNS as well as CVS cases also, right? Good. So then of course, guys, the abdomen. So the abdomen is again important. So you will get so many cases. So it is not that much difficult. So here the CVS is the most difficult, commonest one. So I'm teaching everything in detail and like all these things, necessary things. So introduction and all these CVS, everything, the right CVS, everything, and the syndrome. So the introduction, CVS, and the syndrome. Because guys, CVS most of the time we our command would be do the cardiovascular. This is a 5-year-old child, do the cardiovascular system examination. But not like medicine, pediatrics. The difference is sometimes we are right. Our expectations are also very high compared to medicine, and also sometimes we give syndromic children as well. So we tell you all do the general examination and do the relevant. So sometimes you will notice features of trisomy 21 commonly. Sometimes rarely other syndromes also. So then of course you should be able to identify these syndromic features, and as the relevant systemic examination, you need to do the cardiovascular system. So the thing is, guys, here the important message is, so you need to have a very good idea because there's a high chance of getting a CVS case. So you need to get perfect. So the introduction, CVS, and the syndrome, and like you need 3 classes to finish, right? Then the CNS, it is very, very important and the most difficult one. So many questions will be asked, lateral questions. You need to get perfect. CNS is not only about CP. So you need to learn everything about CP, the develop these diplegic, quadriplegic, hemiplegic, and the relevant discussion points, right? And the examination technique, right? The presentation. Then after that, the hydrocephalus, the neural tube defects, the Duchenne muscular dystrophy, and the other low motor neuron conditions, facial nerve palsy, and these cranial nerve examination, right? You need to have a very clear idea about those things. So for everything, we need 3 classes. මට කරන්න පුළුවන් ළමයි ක්ලාස් එකෙන් නෙමෙයි ක්ලාස් භාගයෙන් කරන්න පුළුවන්. ඒක ඔයගොල්ලෝ පාස් වෙන්නේ නැහැ එහෙම කළොත්. Right? So we need 3 classes, right? For technique and everything, these examination part. Then the abdominal recipe, comparatively easy. So, right? So we are teaching everything, showing the technique and everything. So both abdominal recipe, we need 3 classes. So 1.5 class for each. Right? So then finally the development, neonatal, and miscellaneous. So again, for all 3 we need only 3 classes. So here the important message is, guys, neonatal, don't think that just it's a easy කියලා හිතන්න එපා, right? So there are so many things to learn, and also there can be sometimes these neonates can have 1 or 2 anomalies, right, problems. So they might ask questions related to that. The child might have a hydrocele, or maybe umbilical hernia, maybe undescended testis, maybe a deep icteric, right? Maybe child can have these capal hematoma, or sometimes maybe these newborn skin conditions, right? So erythema toxicum, so many things can be there. So if they ask, you should be able to answer for those things as well. So most of students think like, because the neonatal, miscellaneous. Last time, how many students got neonatal? Previous time, how many students got neonatal? Miscellaneous, so many, right? So especially in Betty and sometimes Ragana, right? We give lot of significant number of neonatal and miscellaneous cases. So just in case if you get such case, or or if you have if you go with an almost zero knowledge, so definitely you will fail in the exam, right? Obviously, I can remember for mass mix practical, after doing so many these live online these things, when I bring those miscellaneous cases, most of students couldn't perform well, right? Very few were able to detect these miscellaneous cases, right? So you can get either skin rash, something like a cavities, eczema, HSP, right? Or maybe a lymph node, maybe a rickets, something like that in your miscellaneous case, right? So the commonest case what you get is CEA, then you need to know these abdominal CNS, then the RESPI, right? Because sometimes RESPI not like the adult medicine, because sometimes it's hard to elicit the physical signs in small kids, and right, that is and difficult to assess the technique in small kids. So that is one reason, but still we are giving. So that is the fourth commonest case. Then the development, right? Again, we commonly give. Then finally the neonatal and the miscellaneous. So you need to study according to this order: CVS, CNS, right? When we are doing these online exams and the specializing practical, that we can come to the hospital. Then the abdomen and the respiratory. Then again doing these online exams, and then you develop a neonatal miscellaneous and doing an online these revision, these exam and these questions, right? Revision questions. So you will get perfect after that. Good. So hope you had an idea about short cases. I'm not going to complete the introduction to short cases. It is there in your platform, so you can cover that. So that is again extremely important. You should cover that introduction to short cases in your platform. That will give you so many clues and will give you guidance to overall short cases performance. So guys, I don't take much time, so I am moving to the most important part, that is the CVS examination. So I want you all to take the CVS examination note. Right, guys. So, guys, I want you to switch on your cameras, focus your face, put your correct names. As I mentioned previously also, it's VIVA is all about talking, right? So this is right part of your training, right? You should have confidence, right? So you should be able to talk in front of me, as well as it's like live sessions. Everyone will be there sometimes, right? So long cases exam, significant number of students will be there. At the same time, 20 to 25 students will be there in one slot. So you should be able to perform in front of them, right? So, and sometimes even in mass mix practicals, you need to perform, right? If I ask you to come and perform. So you should have confidence. So if you have that much of confidence, you don't need to worry at all. You can perform well in your exams. සමහර ළමයි fail සමහර විතර මං හැංගිලා ඉන්න කවුරුත් දන්නේ නැහැ මං fail වුණා මමයි exam එක විතරයි දන්නේ අපි දෙන්න විතරයි කමන්නේ. So you can decide. සද්ද නැතුව ඉඳලා fail වෙලා පාර වෙලා යන්න. Right? Okay. So here the important message is VIVA is all about talking and confidence, right? So pata gala uttara denna. But here English is important. but it is like then you can talk nicely and talk with confidence. But keep this in your mind, even if you're weak in English, doesn't matter, right? This is not an English exam, okay? So just if you have a little bit in, like if you can just manage, that would be enough. Even if you speak in Sinhala, like doesn't matter, right? I can remember English Russian student can. Then I ළමයට මම අන්තිමට මම ඒ ළමයාගේ ඔය කෑලි කෑලි අඩු කරලා ට්‍රේන් කරලා යාට ප්‍රසන්ට් කරන්න එපා මේ කෑලි කරන්න එපා මේ කෑලි කරන්න එපා මෙච්චරයි කෑලි අඩු කරලා කිව්වේ. ඊට පස්සේ ඒ ළමයාට ඩිස්කෂන් එකේදී මම කිව්වා ඔය එක්සැමිනර් කියලා සිංහලෙන් කතා කරන්න. අවුරුදු ගාන ෆේල් වෙවි ඉන්න. ගාවට please talk in Sinhala to get through the exam. අවුරුදු ගාන. Right? Even last time also, I can remember in my VIVA batch, there were 8 students there who were older to much right? ඒ කවුරුත් මාගේ classes ආපු අය නෙමෙයි කලින් නැත්තම් කියන දේවල් එකපාරක්වත් long cases exams වලට ආපු අය නෙමෙයි. right? ඒ ඔක්කොම මේ ඊයේ පාර පාස් වුණා long cases exams වලට ආවා. right? සමහර අය හැංගිලාම ඉන්නවා long cases exams වලින් නැතුව එතකොට difficult. Okay? So here, so switch on your cameras, put your correct names, right? So join and participate actively, right? Even you make some mistakes, doesn't matter. This is not an English exam. As I'm telling you all, Sajid Premadasa should be able to score the highest marks, right? Yeah, right? So the VIVA, you will see everything. Thing, එක જાති ළමයි ඉන්නවනේ ගාලා පොත ගහන ළමයි ඉන්නවා confidence පිට වරු කියන අය ඉන්නවා අය දරුවෝ හොරකල් කරන අය ඉන්නවා right politicians ආගේ but ඒකක්වත් වැඩක් නැහැ වැදගත් whether you can identify the physical signs and interpreting in a properly. So CVS examination. So CVS examination, guys, so we are giving these what are the commonest cases you get in your exams? මොනවද exam එකේ හම්බෙන්නේ? Very easy, guys. Almost always VSD top. VSD top. VSD top. Right? Lazy the lazy. Right? 70% of the 80% of the students will get either VSD or top. So you will, right? It's not difficult. Still students fail, right? That's it. Fail when අමාරුයිද නැද්ද? fail වෙන්නයි අමාරු ළමයි. right? අපි දෙන්නේ ලේසිම cases. ඒත් fail වෙනවා සමහරව. right? So we are getting only the VSD and top. Can you all hear me clearly? Yes, can you all hear me? Give me a thumbs up. I don't see. Right, great. Okay, right. So VSD and ASD, VSD and top, VSD and top, VSD and top. So sometimes we give ASD and extremely rarely we give a PDA, right? So that's all what you will get, right? So then of course, guys, those are the common things which we expect you all to know. But sometimes, guys, top child can have associated BT shunt. So still the top, right? But the murmur, like you might see an additional scar and a murmur, that is a possible variation. So the VSD and top plus or minus BT shunt can be there. Then sometimes you might get an ASD and rarely you can get a PDA, right? So then of course, guys, sometimes, right, you can get trisomy child, right? Right, trisomy child. So trisomy 21. So most of the time, okay, I will ask a small question. So Amali Kannanga. So can you tell me, dear, what is the commonest congenital heart defect where you find in children with trisomy 21? Can you please unmute and say? Is Amali? Sorry, I didn't hear you.
VSD.
Okay, good. Jatila?
ABCD, sir.
Okay, great. So here the important message is, guys, what? So the trisomy child, most of students, they think that the commonest congenital heart defect is VSD. The reality is, guys, the 60% of these congenital heart defects are atrioventricular canal defect, or the AVCD, or the atrioventricular septal defect, or the atrioventricular canal defect. That is the commonest congenital heart defect you find in trisomy 21. But you will see the you in both conditions you will hear a pansystolic murmur. It is difficult to differentiate, right? But so even if you say VSD, we will give you marks, but you will get more marks if you tell atrioventricular canal defect. So that is the commonest congenital heart defect. Both conditions you will hear a pansystolic. The AV canal defect is the commonest. Then the second one is the VSD, right? So as I mentioned, so next the condition where you can get in your exam is the trisomy 21 child, most of the time associated with AV canal defect, and rarely the child can have either top or an ASD. So rarely you might get an MR is not Mahinda Rajapaksa, it's about mitral regurgitation, right? So child more than 5 years, right? So you need to think if you hear a pansystolic murmur, but rarely less. So the rest of the conditions are extremely rare, right? So extremely rarely you will get an AR child with Marfan's. You don't get, right? And extremely rare you might get dextrocardia with another murmur, right? So we don't give ARAs, we don't give AS, MS, right? Those things we don't give usually, right? So you don't need to know about those things. Know the common conditions, just have a rough idea about the rest of the things. That would be more than enough. So I want you all to get perfect in VSD, tetralogy of palate, and ASDs, and also the trisomy 21. So if you perfect in those, you will definitely get through it, right? So හැබැයි ළමයි කාගේ හරි ඉතින් හතර කේන්දරයෙන් පාළුයි නම් ඉතින් මේ කාලේ girlfriend කතා කරන්නෙත් නැහැ, boyfriend කතා කරන්නෙත් නැහැ, right? කවුරු කිනා වෙන්නෙත් නැහැ, කියන එකට බැනුම් අහනවා. අන්න කියනවා නම් සමහර වෙලාවට කේන්දරේ අවුල් වෙන්න පුළුවන්. So you can get extremely unlucky, right? But and if you are average student, and if you haven't covered the classes properly, and if you haven't studied, and on top of that, if your horoscope also problematic, then of course sometimes you might get a rare case and you can get failed. But usually that will not happen. Okay, good. So that is all about the cases what you can get in your exam. So easy. Fail when the lazy right? Fail වෙනවට fail වුණොත් හරි ළමයාට tag එකක් දෙන්න ඕනේ. I can't believe, right? සමහර students ලා ඉන්නවනේ අවුරුදු ගාන fail වෙනවා. Oh, what is possible, right? Yeah, if you fail වෙනකොට මම හිතන්නේ he or she shouldn't do medicine. අවුරුදු ගාන fail වෙනවා නේද? අපයාන නේද? Not difficult, but if you have got like the main reason is you get failed if you don't get the proper guidance. Guidance එක හරියට හම්බෙලා fail වෙන්න විදිහක් නැහැ. එහෙම වෙනවා නම් එහෙම නෑ. Right? You don't get විද්‍යාඥානෙ පහළ වෙන්නේ නැහැනේ. So most of students get failed because they are learning the incorrect things. දේවල් ඉගෙන ගත්තාම සහ මොනවාද focus කරන්න ඕනේ කියලා දන්නේ නැතිනම් fail. Good. So we'll move to the CVS examination. So CVS examination, guys. So there are several things which you need to know. One thing is you need to know the technique, right? The technique, of course, I will be teaching in a separate class, as well as it will be like it is there in the platform. The video is there where I am teaching everything so nicely, so you can see those things. But here I'm here now, of course, I'm mainly focusing on the main important component, where the interpretation of the physical science. Where to interpret the knowledge, then as I mentioned, it is the most important thing. So today, of course, I'm highlighting the facts related to the interpretation of the physical science. So if you can interpret properly, so you will get through, right? You can easily get through the short case. So here, CVS examination, there are several components out there. Where like, you need to go through the general examination, then the something in between, then the precordium, where it will contain the inspection, palpation, but percussion is not there in CVS, and finally the auscultation. So general examination and something in between is there. So what is something in between means? So in CVS, it is about assessing the pulse and the blood pressure. RS, it is about assessing the respiratory rate. CNS, it is about assessing the gait. Then GI, it is about assessing the lymph nodes, right? General liver precordium or the main system එකට පයින්න කලින් අතරමැද දෙකක් තියෙනවා. There, if you miss that component, we will significantly reduce your marks. කවුරු හරි ළමේ pulse, blood pressure, CVS බැලුවේ නැත, respiratory rate එක RS බැලුවේ නැත, if you don't check the lymph nodes in GI, or if you don't assess the gait, or if you don't comment about the gait at all, so we will reduce your marks significantly, and you, right? That will be there. So make sure there's something in between before you jump to the main proper or the precordium or the proper system, right? So you need to start with the general in most of the children. So here the important message is, guys, I told you I'm teaching you all about the interpretation of the physical science. So each clinical sign will give some clues. So some clinical signs, guys, give clues for the diagnosis, right? Diagnosis clues then for example, if you hear a pansystolic murmur, or if you hear an injection systolic murmur, so that will give you a lot of clues. It will like narrow down your DDs, and like you can tell the almost the diagnosis. It will give you the clue for the diagnosis. Pansystolic murmur එකක් ඇහෙනවා නම් left lobe pansystolic murmur එකක් ඇහෙනවා නම් it should be either VSP or MS. කොට වලට අග්ගාලා හරි. මේක තමයි ලෙඩේ කියන එක මේක clue එකක් දෙනවා. Then guys, but sometimes your physical science, detecting physical science can give clues for complication. Right? Complication එක clues දෙන්න පුළුවන්. For example, so how many? I will ask a small question. How many? Yes. Can you please unmute? Then Danula. After how many? It's Danula, right? So how many? Now tell me. If you hear a loud second heart sound in your auscultation, can you, like, you can make mistake, doesn't matter. So what do you think? That will give clues for what? Do you think? That will suggest what?
So can you hear me?
Sorry?
Can you hear me, sir?
Yes, I can hear you, dear.
Sir, I think there'll be pulmonary hypertension.
Excellent. So the pulmonary hypertension. So if you hear a loud P2, that indicates child is having pulmonary hypertension, but that is a complication, right? So again, Kavni, I will ask this another one. So if you see, if you feel child is febrile, what are the possibilities?
So there's an ongoing infection.
Ongoing infection, very good. So the cardiac patient, what are the possible common ongoing infections they can have? They can have viral fever also, but more than that,
Infective endocarditis.
one thing is infective endocarditis. Okay, good. So, but even though we say about infective endocarditis, you will never get in your exams. කවදාකවත් ඔයගලගේ exam එකට අපි infective endocarditis ලා මේක දෙන්නේ නැහැ. දීලත් නැහැ. right? ඔය ළමයි ඔය list එකේ දාන ඒවා හිතන්න එපා. ඒවා ගන්න බොරුනේ. right? මට මෙහෙම එකක් ආවා මම මෙහෙම උත්තර දුන්නා අරෙන් උත්තර දුන්නා මෙහෙම උත්තර දුන්නා results එද්දි තේරෙයි. ඊ බොරු දාන්නේ. ඒ ඇත්ත case එක නෙමෙයි. They don't know about the case. Sometime after the case, of course, I talk with the students, then I get the idea about what they really are and how they performed and what is the case they got. Right? Okay. So infective endocarditis you will not get in your exams, pediatrics. Huh? So if you notice fever, but they can be associated with another complication. That could be most of the time. On top of that, you might hear another physical, you might be able to detect another physical sign. So what is it commonly? What do you think? Commonly? No idea.
I'm not sure.
Danula? No.
So is it rheumatic fever?
Acute rheumatic fever එකක් තියෙන ළමයිට ගොඩක් වෙලෙත් දෙන්නේ නැහැ ඒක මොකද?
Then some recurrent infections due to them, plethoric lungs.
So what kind of infection?
Upper respiratory, lower respiratory infection.
Lower respiratory tract infection. So you on top of that you might hear some post-scripts. No, very good. So the lower respiratory tract infection is one possibility. So most of the time, if you notice fever, most of the time child might have associated lower respiratory tract infection and or maybe infected. That will give a clue for a complication, right? Good. So Danula, so tell me, if you feel a liver, 2 centimeter size mildly tender liver is there, the child with a pan-systolic murmur. So what do you think? What is the possible complications?
Heart
serious. Very good. Heart failure. Right? So that will give you a lot of clues, right? So some signs are there which will give you clues for a complication. So then guys, but sometimes some signs can give clues for the etiology. Most of the time, we will not give any clues for etiology, but some children you might see sometimes some signs might give for diagnosis for etiology. So commonly you might notice. So Tishan, you can tell. So you heard an pan-systolic murmur. So then you notice the child is like very fair child and so there's an flat nasal bridge, epicanthic folds, upslanting eyes, hypertelorism, and very frog-like posture is there. You saw some, and the child is always protruding tongue out, 6-month-old child, protruding tongue out with a frog-like position. So what do you think, Tishan? What do you think? What is the most likely condition?
The Down syndrome?
The trisomy 21 or the Down syndrome, right? So somehow we'll do the cardiovascular කියන්න පුළුවන් ළමයාට trisomy තියෙන්න පුළුවන් ළමයාට etiology most of the time congenital heart defects occurs due to like genetic influence or maybe unknown reason, right? But sometimes they can be associated syndromes where it is a risk factor for the etiology. මේ syndrome එකකින් the heart disease එක ආවේ, right? So the thing is, guys, sometimes you might notice clues for etiology. I'll give you another one, but give you an answer to the question. Jatila, you can tell. 6-month-old child, nowadays you will not see, 6-month-old child, there's a developmental little bit delay and eyes are whitish in color. And you were able to feel liver and as well as the spleen. And also the chin is very small and you heard a continuous missionary murmur. So what is the most likely condition?
PDA, sir?
PDA, very good. Why the child is having this very whitish color eyes, right?
Not enough blood is being circulated. Not sure.
Anyone? What do you think? Like, what is the possible likely condition? Ruwanka?
I think probably because of congenital rubella syndrome.
Yeah, the congenital rubella, right? So nowadays you don't get, but I have adult patients. But even the last rubella patient also, like years back, I actually showed to some students. Yeah, I said, "How to rubella babal hambun hai?" But there are a little bit old, bigger children are there. But you don't get in your exams, right? Just I mentioned, right? So you just need to know about the trisomy 21, but not much about those things. Then finally, guys, sometimes the clues, they might give clues for the current risk factors, right? For example, dental caries. So the dental caries is, guys, what? So tibba කියන එක මුකුත් කියවෙන්නේ නැහැ, right? So just that is a risk factor to develop a complication or an infective antibody. That's all. Even if you detect or not, that doesn't change anything. So here the important thing is, guys, what? So in your exams, right, you need to focus according to this order. So make sure you somehow detect, you never miss the clues for the diagnosis. If you miss those, there's a high chance of getting failed in the exam. Then the important thing is the complication and the etiology. The risk factors, of course, so important. So the diagnosis is the most important thing, right? The clues for the diagnosis. So we'll move to the, yes, you can take these note. So in general examination, so when you see a child, so you can, I'm not going into detail about these things. So general examination as a distant look, you can have an idea whether the child is active, well-looking child, or whether the child is ill-looking. And right, so I will ask a small question. When you're presenting, it is important. So Danula, so tell me, what is the difference between child and the baby?
The baby is like small ones, like less than 1 year.
Very good. What baby can the bear motor? Baby can the pulua if the child is less than 1 year, or to your girlfriend. Then Ari Kaur can the pula. Okay. So the baby should be less than 1 year. So for other children, you need to use the term child, right? So if the patient is an infant, you can use the baby, right? So whether the child is active, well-looking child, and whether the child is lying comfortably, right? And you can have an idea regarding the growth, right, by looking at distance. And also you can see whether the child is having dysmorphic features or not. So you will learn those things, right? I'm not going into details. And at the same time, you can look at the surroundings, whether the significant things are there, right? Whether there is an oxygen tank, whether the child is with a cannula or not. So you can have an idea about those things. So then, guys, we are moving to the most important part, where the examination of the head to toe. The only in the components are getting. So what are the components which you need to assess? So whether the child is febrile or not, right? Then febrile then at the clinic. That is the first one. Then when it comes to eyes, related to CVS. So tell me, Lasita, what are things you are going to assess?
Sir, plethora.
Very good. Okay. So very good. So then Amali Kandangara, what are things you are going to assess?
Jaundice.
Why do you want to check icterus? Yes, here, this is right. You can make mistakes. That doesn't matter. So in your exams also, this is very important. In your exams, guys, so most of the time, if you tell something not directly related one, so they always ask why. Why did you mention? Why you are making people? Why did you mention? What is the significance? So the CVS examination, even we say general examination, it should be always related to CVS. The general examination related to CVS. So in abdomen, of course, if you tell icterus or the jaundice, doesn't matter, like that is always relevant. But in CVS, if you tell jaundice or icterus, then they can ask why. So most of the students, they say and they frequently ask. Then of course, then you need to tell something rational. So the adult medicine, of course, you can say something like, because you are telling those findings after examining the child. Like examine you can't give a running commentary in CVS, RS, CNS, and GI, right? So you need to examine first and need to tell the findings. So if you tell like that, then you need to tell something rational. Monohari valvular heart replacement with an hemolysis, something like that. Where you hardly find those kids in pediatric setup. So you can't tell those things, right? So it's very important, don't mention about icterus. So, yes. So anything else? So what are things you are going to assist? Amaya? Face and the mouth. Eyes, mouth,
Conjunctival pallosa.
Hello. Okay. So now, hello. What is the significance of hello?
You can assess whether the child is anemic, sir.
What is the significance of anemia in CVs?
So the child can be in heart failure. There you can get anemia. The child might be having some sort of a bleed. Or else any problem related to anemia, problems in production, excessive destruction.
Okay, yes. Okay, it's like very good, very good. So here it is, I will tell you. So that the phallo is important. The important thing is like sometimes the children with congenital heart defects, they have difficulty, like they will have failure to thrive since their metabolism is so high and they are unable to stay. Sometimes if they are dyspneic, they are unable to take these oral feeds properly, so they can have associated nutritional deficiencies as well as on top of that anemia. That is true. And also if they have associated the anemia, on top of VSD, of EDA, the heart failure can get worse, right? That is the other. But here the important message is the hello, does it give any clues for the diagnosis? Diagnosis is then face එක අන්තිමට එන්න ඕනේ මේක VSD එකක්ද top එකක්ද VSD එකක්ද no, right? ඒ වගේම like the other important message is like hello, heart failure mainly in congenital heart defect again, not due to the anemia per se, right? So just a contributory factor, right? So here you can, of course, no doubt, if you mention, you need to mention phallo. We will not reduce a single mark, we will give mark. But more importantly, there is something more is there where you need to come in. What is it? As Lasita mentioned, what is it, Ayesha? Ayesha Rao? Rao, Ayesha? Rahu? What is the more important? Can you tell? Yes. Yeah, the plethora. Guys, the plethora is the most important. Plethora is, guys, what? Just like Rao's the shawl, right? It's the very dark velvety red color, right? So that is the most important thing. If you notice plethora. So your exam cases are what, guys? So in your exams, you can either, you can get either ESD, right? PDA, ASD, and top. So if you notice plethora, VSD at plethora, do you see plethora in VSD? No. PDA at another? No. Do you see in ASDs? No. You all only see top. That's all. Plethora දැක්ක කියන්නේ මොකද්ද? top. වැඩේ ලේසිද? ඔය පටන් ගත්ත ගමන්ම ලෙඩේ හොයාගෙන වගේ තමයි. Plethora නැත්තම් unlikely to be top. Pediatrics is easy. Good. So then, guys, so you need to look at the mouth. So you need to check whether the child is not pale or plethoric. You need to come in, right? Plethoric when you are presenting also, the tone is very important. Don't go in a monotonous way, right? So tell in a loud, no plethora. That is important when you're presenting. So then, good. So Imalshi, now tell me, dear. So inside the mouth, what are things you are going to check? Inside the mouth, of course, you can check the dental caries. That is not so important. What are the important ones you are going to check in Imalshi? So tell quickly.
So for central cyanosis.
Cyanosis. Excellent. Cyanosis. So BSD, will you notice cyanosis? No. PDA? No. ASD? No. Only top. That's all. Where did you see that? Then guys, but at the same time, Samarvilla cyanosis, the nil part, you will notice bluish discoloration in the buccal mucosa or the tongue, right? You will notice classically. So here the important message is, guys, what the Okulangi lips baland, Monapata, Gan Lamagis, pink color, in children also, guys, it is usually this pinkish in color, right? So if you notice, it's very difficult to appreciate very dark bluish in color, but if you notice very dark color, right? So you always need to think whether child is cyanotic. Reassess these plethora, right? Plethoric eyes, cyanosis, and also finally the plethoric tongue. Plethoric tongue. So again, you will only notice in tetralogy of the top. Very there. Pediatrics is easy, right? So then, guys, what? Then you can move to hands. So when you go to the eye levels and you assess the clubbing, whether child is and clubbing is there or not. So if the child is and clubbing, BSD at clubbing another, BSD another, nah, PDA another, nah, ASD another, no. But you will only find in top. That's all. Only in cyanotic heart lesion. Why? Because tetralogy of Fallot, they have a right to left shunt and the deoxygenated blood going through the systemic circulation. So what happens is then of course they will have hypoxic situation and the kidneys will detect our child is in a hypoxic state and they will produce more and more erythropoietin. So due to deoxygenated blood, they will be cyanotic. Due to excess production of erythropoietin, they will be plethoric, and due to cyanotic, these deoxygenated effects, they will develop clubbing. So you will see plethora cyanosis and the clubbing only in top. Oka that code, top. Oka that can it's not top. Hataring eka, gatta the netan. වැඩලේසිද fail වෙන්න පුළුවන්ද good. So the thing is, guys, then of course you can check in the hands. There is something called peripheral stigmata of infective endocarditis. You can comment about that. So there are two important signs are there: Osler's nodes and the chainway lesions. Right, the pictures will be there. You will I will teach you more in detail later. The Osler's nodes are where you will notice tender nodules over the palm, right, the tip of the fingers. And the chainway lesions are non-palpable, non-tender lesions are there in the thin aspect and the hyperthin aspect of the palm. මේ ඇඟිලි තුඩුවල ගැට වගේ tender nodules තියෙනවා, that is Osler's nodes. Then chainway lesions are what? The palmar aspect එකේ තියෙන non-tender lesion. Today in your exams, of course, you can comment about peripheral stigmata of infective endocarditis. In your exams, like the thing, then they might ask what are the peripheral stigmata of infection. Then you can comment the Osler's nodes and chainway lesions. If they ask during our discussion, how are you going to differentiate? You can tell there's a tender nodules over the pulp of the fingers are the Osler's, and the chainway lesions are the non-tender, non-palpable lesions in the pathina aspect. So here the important message is, guys, one. So will you be able to see is it a common thing or uncommon thing to get in your cases, right? Short in your short case. What short case exam එකේදී ඔයාට ගොඩක් වෙලේට හම්බෙයිද නැද්ද කමිනි? What do you think? මේ Osler's no generations exam එකේ හම්බෙනවද නැද්ද?
Rare, sir.
Osler දැක්කම තමයි. ඊට පස්සේ lazy එකට මොකෙක්වත් දැක්කේ නැහැ, right? So it is extremely rare, right? I've been working in a cardiothoracic unit previously, then during my career I have seen maximum of 2, right? Or 3. My HRI කියන්නේ මම දැන් 10,000ක් විතර cases දැකලා තියෙනවා, serious cases, but you will not find, right? So here thing is that is rare. You will never ever find in your exams. So just you are commenting, but don't waste time or focus on those things. So focus to detect plethora. හොඳට බලන්න plethora රතු පාට velvet appearance එකක් තියෙනවා. දිව එළියට දාම මේ lips හද පාට දිව rose රද පාට තියෙනවා. clubbing හොඳට තියෙනවද නැද්ද? ඒක දැක්ක කියන්නේ වැඩේ ගොඩ. Right? So then of course you can do the check for the bilateral pitting ankle edema. So that is there. So that's all about general examination. But the like I told you, top is the first most common or second most common case which you get in your exams. Why do we give this case? Because it is, signs are very classic. You can detect so many things and it is very classic. So there are whether we can assess your skills, right? Whether you can detect cyanosis, clubbing, all those things. But unfortunately, some students, significant number of students, they fail to detect those physical signs, and they'll finally only during the discussion, පුතා ඉතින් ආයෙ ගිහිල්ලා බලන්න ඔය මොකද්ද තියෙන්නේ? Then only they get to know මේ ළමයට තියෙනවා කියලා. හැබැයි ඒ කැලේ ටික දාන්නේ නැහැ. ඕගලන්ගේ අර chat box එකේ දාදී I got a tough child, they asked these things, I කිව්වා මේමයි, right? It is like that. So here most of the students fail to detect those signs. Now, what can you do for that? මොකද කරන්නේ detector emulsion. What do you think? මොකද ඔයා කරන්න හිතන්නේ? දැන් cyanosis දිව දාගම මේක හැටිද දාන්නේ නැහැ. මේක නිල්ද හැටිද? ඒතකොට රතු පාට මේ ළමයාගේ ඇහැ බලන්නත් අමාරුයි, ළමයා දෙන්නෙත් නැහැ. Right? Very small kid, not allowing to check. Right? Sometimes child can be irritable. Sometimes child might cry. අඬනවා. බලන්න බෑ. What can you do? Emulsion, Fernando, what are you going to do? How are you going to detect? If you don't detect that, so it is difficult. So if you can detect those things at the beginning, so you can come to the conclusion at the beginning, right? Yes, Himashi, what do you think?
So in examination, in a short case,
yeah.
So can we ask?
No, you can't ask anything. Short cases, shut up. That is how it goes. Now, some children, for example, especially children who has undergone an VT shunt, sometimes you might not be able to appreciate clubbing and cyanosis and plethora that much. A bit difficult. So how are you going to detect? Anyone? Done with it?
So we can check the surrounding to see any oxygen tanks are there.
So will it support? So do we give oxygen frequently for children with TOP? No, more than that for ESD patients we give, because they goes into heart failure and respiratory tract infections. Anyone? Come on, guys. What am I practically exam එකේ problems? ඉන්නේ ඔයගොල්ලෝ දැන් කොච්චර හිතාගෙන ගියත් ළමයි ඒකයි fail වෙන්නේ හේතු. If you ඕක මේ classes වලදී මේකයි practically problem එක. මේකයි කරන්න ඕනේ. දැන් these online exams also, that's why important. So I will giving you these videos, pictures, then you will tell me එහෙම ලෙඩෙක් ආවොත් මන්ට මොකද්ද වෙන්නේ? මොකද්ද කරන්නේ? මොකද්ද මේ errors වලට කරන්නේ? What are you going to do? Yes.
Clubbing, sir.
Excellent. Who's this? Who said that? Yumi. Very good. Guys, look at the toes. Even child is irritable, even child is on breastfeeding, right? Or while you are examining. So what like whatever it is, you can see these toes, right? So because toes has the least circulation, right? So you will notice prominent clubbing and the cyanosis over toes, right? So don't miss toes. Then you will not miss. Okay, exam fail වෙනවද නැහැ, right? So that is how you did it. So if you then ඕක දැනන් හිටියේ නැත්නම් exam එකට 100 පාරක් ගියත් ඒකම තමයි වෙන්නේ. Like those facts, are they like over තියනවද එක පොතක හරි? මට පොතක් පෙන්නන්න toe clubbing cyanosis තියෙන කතාව. Right? That's why it's very important to join these classes, right? So you will not, right? Good. So then guys, that's all about general, right? General examination, that's all. So hope you are clear. So if you notice this, so then the general examination top very easy. So if you have detect these cyanosis, plethora and clubbing, so it is likely top, and it is not unlikely to be top. It's not top. Then Pandita Kata කියනවද නැහැ. So you might think එහෙම කොහොමද sir කියන්නේ VSD Eisenmenger සාවත් cyanotic වෙන්න පුළුවන්. PDA Eisenmenger සාවත් cyanotic වෙන්න පුළුවන්. Do you get an Eisenmenger's child? In your exams, ඔකන ගැර list වල දානවා. No. Right? So because Eisenmenger child, we don't keep till then. Till they develop Eisenmengers, because then it's inoperable. So they will suffer and die, and the murmur will not be prominent. So you will not be able to hear a prominent murmur. So you don't give in your exam. Some කෙනෙක් කියනකොට සර් කොහොමද මේ උගන්වන්නේ VSD කවුරු හරි කෙනෙක්ට infective endocarditis එකක් clubbing එන්න පුළුවන් නේ. Do you get in your exams? හරිද? So learn what is necessary, focus on what is necessary, you will, right? Easy. Clear? Right, we'll move to the next important one. So after finishing the general examination, HTO examination, so you can, I told you before jumping to the precordium, there is something in between. So what is that? There are important things are there. What are those? So pulse and the blood pressure, right? Good. Now, tell me, right? So pulse, of course, the sites and everything I will teach all later. So here the important message is, guys, what pulse? There are 4 important things are there which you need to assess. So one thing is what the rate, one. Then the rhythm, then the volume, and finally the character. Rate, rhythm, volume, and the character. Yeah, එකලාමේ කියනවානේ ඈත මම අර වීඩියෝ එකක තිබ්බේ ඈත ඉඳලා දැක්කහම උනත් ලෙඩේ කියන්න පුළුවන් කියලා. කියන්න පුළුවන්. Even in CNS, even in you can tell. Right? It's not a. So now tell rate, rhythm, volume, and character. So there are those 4 components you need to assess in thoroughly, right? So Kasun, doubly you need to put your correct name. I don't know whether you are a student and you need to switch on your camera. I told you previously also. If you don't do it within 1 minute, I am going to send out. Yes, Kasun. So tell me. Because guys, only students are allowed to join, right? And some are allowed to various people actually they join. Right? When I was doing that shift now, right? I can remember one person was asking very different questions, right? Then මම ඒකට තේරෙනවා ඉතින් මේක ස්ටුඩන්ට් කෙනෙක්ගේ අහන එක නෙමෙයි මම අනිත් පැත්තට ඉතින් ක්වෙස්චන් එක මේවා කරලා අහනවා. අහපු අනිත් පැත්තට මාත් එකක් අහනවා. ඒතර මුකුත්ම කියාගන්න බෑ. හිර වෙනවා. ඒක මම දැන් knowledge එක තියෙන්න බෑ. එහෙමනම් එහෙම මොකුත් නැහැ. Then I noticed there is a hen හැනක් තියෙනවා සාක්කුවේ, right? ඒකේ light එක dim වෙනවා පත් වෙනවා. So right, I think කැමරාව දැන් මේක මම එළියට අඬ ගහලා ගිහිල්ලා then I talked with that student. So then I said I am going to inform the police. Then he got scared and he told who sent and everything. So right, there are various people are there. I can remember the past picture girls like those days they are asking all the materials and everything. They allow picture under teachers like so many things are there. It was not because I started when I was an RH. Sorry, pre-intern, and I joined the C9 when I was an RH, just after my internship, right? No one can't penetrate this field, no, you know that, because the thing is, like, I am the only person who was able to, like, found very recently, me and these Rajiv තමයි අන්තිමට මේ field එක දෙන්න ලේසි නැහැ, right? And still I am the youngest ERPM teacher, so there are people are there various things. එහෙම තියෙන්නේ ඊට පස්සේ මම attack කරා ඒ කාලේ GMO එකට complain කරනවා මේවා කරනවා, right? මම සයිටම් ළමයි මොනවාද පරලොට් එකකට උදාහරණයක් ගන්නවා කියනවා mass mix practical එකක් තියෙද්දි ERPM ඔය වගේ ගොඩාක් දේවල්, right? ඔය එකක්වත් තිබ්බා. ඉතින් වෙනස් වෙන්නේ නැහැ, right? ඒක දේවල් නම් දැන් ඉච්චරම නැහැ. but ඒ කාලේ පදේට ඒවත් ඉතින් එක join වෙනවා, but that's telling you all only students are allowed to join, right? ඉතින් මොකද මේක called like a mafia, no? This is not මේක මම මේ field එකේ ඉන්න කැමතිත් නෑ. මේකෙන් සාස සයින් වෙන්න පුළුවන් නම් මම කී පාරක්ම නවත්තන්න කියලා හිතලා තියෙනවා. නැහැ මොකද මම නිදාසේ ඉන්න පුළුවන්. The only reason is actually a significant number of students, they really love me. They want to they want to continue these classes. They wanted to continue, so that's the main reason I'm continuing. Otherwise I have stopped, right? So that's why I'm keep on telling you all. There is no any other reason, right? So main reason is that's why I asked you all to switch on your cameras and focus your face, so then I'm aware that you are a student, one else, right? And put your correct name. Okay, good, right? So here the important message is, guys, so that is pulse. So pulse, you need to assess 4 things: rate, rhythm, volume, and the character. So now tell me, guys. Okay. Now, out of these 4 components, there are all 4 are important. Out of these 4 components, tell me, Kasun, what do you think? Out of these 4, what is the most 1 or 2 things which you need to focus? You have to then focus කරන්න ඕනේ වැදගත්ම. Discussing KAZUN.
Yes, sir.
Yeah, what do you think? Out of rate, rhythm, volume, and character, what do you think? What is the most important one?
Rate.
Great, good. So tell me, okay, why did you mention rate? It's okay. මොකද හිත rate එක වැඩි වෙන්න පුළුවන්. The rate is high, but indicator what is the no idea. Aisha Rao.
Rhythm, sir.
Sorry? Rhythm.
Rhythm.
Okay. What is the significance of rhythm? ඔයගොල්ලෝ එක්සෑම් එකේදී කිව්වහම සමහර වෙලාවට අහනවා මේක So Amaya Singh, what do you think? What is the most important?
In CVS, volume of the pulse, since we can assess for PDA.
So the rate of course again you need to assess the rate, guys. So if you notice tachycardia, it is like the child is having heart failure, or if they have a fever, right? The pulse rate can goes up. But in your exam, we don't give very unstable children. So here, almost always, the pulse rate will be like within the normal range. So, like what we have practically seen is most of students need to take only 15 seconds, but most of students they keep their hands and try to count. Because they anyway children will have tachycardia. Right? They restart. Then they restart. So then of course they are taking like nearly 2 minutes to assess the pulse. No. So you don't try to count. Just have the idea regarding normal range and just tell something. Right? When you're presenting. So the neonates, of course, the tachycardia is 180. Infants it is like 160. The toddlers it is 140. Early schooling age it is 120. And the late schooling age 100. So neonate කියන්නේ මාසෙට අඩුවයි, infant කියන්නේ අවුරුද්දට අඩුවයි, toddler කියන්නේ අවුරුද්දයි පහයි අතර අය, early schooling කිව්වේ අවුරුදු පහයි අවුරුදු 10යි අවුරුදු 12යි අතර, late schooling කිව්වේ අවුරුදු 12ට වැඩිය, just like adults. So if you know these තමයි අඩුවනේ. So if you know these ranges, so you can tell the normal weight. වැඩි ටිකක් අඩුවෙන් කියන neonate කෙනෙක්ට 140 විතර කිව්වනම් infant කෙනෙක්ට 120 විතර කිව්වනම් ටිකක් ලොකු ළමයට 100 කියලා කිව්වනම් something like that would be okay. කවුරුත් ආයෙ ගිහිලා අත තියලා count කරන්න දෙයක් නැහැ. The rate will not give any clues for the diagnosis. Then the rhythm, guys, rhythm. So rhythm, guys, the pediatrics, the arrhythmias are extremely rare, and the commonest arrhythmia is SVT, and again it is not associated with congenital heart lesions. Heart එකේ තියෙන සිදුරුත් එක්ක arrhythmia association එකක් නැහැ in pediatrics. But adult medicine, of course, when they have a mitral stenosis, so they can have atrial fibrillation, that is there, but that is important. But in peds, it is not so important. So you can totally forget about the rate and the rhythm. You need to comment the rate is 140 beats per minute and which is regular. But you need to focus on volume and the character. Volume and character. අත තියන් ඉඳි ටුන් ගාලා වදිනවා තේරෙනවද? Volume and character. That is the most important thing. If you notice a high volume bounding pulse, after dong, the prominent pulse at that, high volume bounding pulse. In what condition do you get? Top fight than another? No. ASD? No. VSD? No. You will only feel it. PDA. That's all. Very lazy. Pediatrics is easy. Now, can I trust your pulse? No. ඔයාගේ pulse එක ඔයාටම sure නෑ, මට ඔයගලගේ pulse එක sure නෑ. Can you detect high volume bounding pulse most of the time? So sometimes it is difficult, right? You need to have a lot of experience. So if you don't have experience, what can you do? මොකද කරන්නේ? So guys, there is another method is there. You can check for the collapsing pulse. You keep your hand, both hands, I will teach you all technique, and you raise your hand. So after Utsavu Gama, due to the gravity effect, what will happen? So the thing is, these pulse become more and more prominent. The prominence will get increased. So the collapsing pulse. Don't go. Then the how prominent you will find only in PDA. Very lazy there, very lazy. Now, here, can I trust you? Since you need to come to the reality, y'all are not like us. So you don't have that much experience, right? So the detecting pulse, right? The volume and character, appreciating those volume and character is not so easy, right? So what can you do? How many? What can you do? That's common. What are you going to do? Can you do? Then what the pulse is shown? What are you going to do? No idea. No idea. No idea. No problem.
No, sir, no idea.
No idea. So, anyone? Amaya, are you singer? What do you think?
Dorsalis pedis pulse as if it's bounding.
Guys, this is very important. Guys, you will notice if you keep your hand over the dorsalis pedis in couple, right? So when you keep your hand over the dorsalis pedis, you will notice a prominent dorsalis pedis. So that you will find only in PDA. So the PDA, most of the time, one of the important messages, guys, was the children are almost always less than 2 years, because PDA is a surgery where you can easily correct, right? So it doesn't take like 45 minutes to do the surgery. And we are heading for an early surgery since they are developing early complications. So most of the time, the children will be less than 2 years. So those children, sometimes appreciating these high volume boundary pulse, collapsing pulse is very difficult. But keeping your hand over the dorsalis pedis and prominent dorsalis pedis will suggest PDA. Very lazy. So high volume bounding pulse, collapsing pulse, prominent dorsalis pedis තිබ්බොත් මොකද වෙන්නේ? PDA. ඒක නැත්නම් it's not unlikely to be PDA. වැඩි ලේසිද? Good. Now, guys. Now, Shamil. Now tell me. ඒකත් ඔයාට හරියටම sure නැහැ. එහෙමනම් මොකද ඔයා කරන්නේ? What are you going to do next?
You can ask for the blood pressure. They will have a white pulse.
Excellent, guys. Wow. Excellent, Shamil. So, guys, ඕක තමයි වැදගත්ම. ඔයා මොකද කරන්නේ? So, most of the students, they don't do, and if you don't comment or ask during your examination, they might reduce your marks. You need to ask for blood pressure. Madam, can I know the value of the blood pressure? ඒකට උත්තරේ කීකේවා කියන. කම්ස කරගෙන යනවා එහෙම කියන්නත් පුළුවන්. කරන් යනවා ඉසේ කියලා කියන්නත් පුළුවන් කලාතුරකින්, right? So it is that's all. Or they might say, right? So it is 90 by 60, something like that. So 90 by 60 kilowatt, Shamil, what does that indicate?
Usually they will have a white pulse pressure for PDA. 90
so
by 60.
If they mention 90 by 60, it is not a PDA. වාගේ කේස් එක PDA නම් නෙමෙයි. Right? But if they mention something like 120 by 70, that's 120 by 60, 130 by 70, 130 by 60, something like that. So that indicates wide pulse pressure. Wide pulse pressure means, guys, what? The difference between systolic and the diastolic. So if it is more than 40, we call it as wide pulse pressure. Systolic එකයි diastolic එකයි අතර වෙනස 40ට වැඩි නම් wide pulse pressure කියනවා. So if they mention like 120 by 100, 120 by 70 or something like that, that indicates wide pulse pressure. Or if they mention 100 by 50, wide pulse pressure, right? So that indicates our child is having an PDA, PD. So wide pulse pressure, PDA, PD. Where do you see that? Where do you see? Pediatrics is easy. Then ලෙඩ දෙකක්ම පටන් ගත්ත ගාම කරගත්තා. Easy then. Even if you, just in case if the child cries and if you didn't hear the murmur properly, right, still you will be able to get some clues, like lot of clues, and come to the conclusion just right at the right, just doing the general examination and the rest. Got it? Good. Pediatrics. Lazy Amaruida? Lazy. Oka Amaru කරගන්නේ කවුද? ඕගොල්ලෝම තමයි වැරදියට එක එක ඒවා ඉගෙනගෙන, right? So it is very easy. So here the important message is, guys, right? Good. Now tell me, in your adult medicine, in what condition you will notice white pulse pressure? Rarely only you will get in your feet, but sometimes. Nasita, what do you think?
Sorry, sir, I have no idea.
You're seeing, I'm just asking. Hey, question. You did CVS in under medicine? Then කරලා තියෙන්නේ කරාද පටන් ගත්තද?
No, sir.
No. So anyone?
Yeah.
Aortic regurg, sir.
Guys, AR, aortic regurgitation. I can remember even my exams, guys, medicine exam, right? We were getting 4 short cases. So the serious one, like, so during my general examination, after general examination, I did those things. I felt like high volume boundary. Then afterwards, I asked the blood pressure. So they said something like 140/60. Ada bakas gala hina gaya. Right? The case is good. Then of course, like then I හිතනවා self then අනිත් DD ඔය වගේ මෝඩ විදියට හිතන්න short case කියන්නේ ඔයගේ valvular lesion එක හොයාගන්න, right? Sepsis වලදී wide pulse pressure එනවා. ඕවා හිතන්නේ නැහැනේ sepsis patient කෙනෙක් නෙමෙයි valvular lesion එකනේ, valvular lesion එකක් හරි heart lesion එකක් නේ, heart lesion එකක් නේ. You need to think about, right, about these things. So it is about air. So then finally I said, like, after examining everything, this patient is a medicine case. This patient is very tall. I would like to assess the height as well as upper segment to lower segment as well as features of Marfanoid. They asked, okay, go ahead. What are you going to assess? Then I said, lens dislocation, high arch palate, right? These arachnodactylity, thumb signs, read signs, and right, where hyposcolia is slightly vertically here. Okay, maximum marks. Right? Good. Then කවුරුත් ඒක detect කරලා නැහැ patient all patient මේ features තියෙනවා කියලා medicine, right? Okay. I think that's one of the reason I had a very good mark, right? Even in medicine, right? So you need, like, thing is in PEDS, of course, it's very easy. High volume boundary pulse, collapsing pulse, prominent dorsal PDs, and the blood pressure, wide pulse pressure, that indicates what? So PDA. Easy? Now guys, tell me. Then what is the answer? How I cut, අපි බලන්න ඕන එකක් ඒ අතරේ. What is that? Jugular venous pulsation. මේ JVP කියලා ලිව්වට කවදාකවත් ওই වචන කියන්න එපා. දැන් නම් කන්සල්ට් කරලා ඉගෙන. ඒගොල්ලෝ ස්ටුඩන්ට් කාලේ කැමති, ඊට පස්සේ අග්ගි හම්බුනහම එච්චර කැමති නෑ. පීඩිත වෙලා අවස්ථාවේ තමයි කැමති. ඒකට ඒගොල්ලෝ අකමැති ආයෙත් ක්‍රයිසිස් වගේ තියා පොඩ්ඩක් කැමති ආයෙක බහැලා යනවා ක්‍රයිසිස් එක අඩු වුණා. ඒකට සාමාන්‍ය so always use the complete term jugular venous pulsation, right? එතකොට ළමයි jugular venous pulsation කියන වචනේ use කරලා ඒක important in your medicine. But keep this in your mind, pediatrics, you don't. So you can completely forget about that. Just focus on what I mentioned. That would be enough, right? Jugular venous pulsation, you don't need to comment or you don't need to assess, right? So it is where even theoretically also we are telling only if the child is in a significant distress. So only you need to check, otherwise not. But again, we will not give unstable children in your exam, so you don't need to check it out, right? So pulse and blood pressure, hope you had a clear idea. So the next pulsation includes these Morgan sign as well as tubular venous pulsation. So both you don't need to assess in your case. Clear? Good. Any questions up to now? Guys, right. So we are moving to the next most important one, but shall I give you a small break? 10 minutes break, yeah, take up the blender, right? So I will see you in 10 minutes time, so you can have a small drink, small tea, right? Right, guys, can you please switch on your cameras and right, guys, we need to start. Switch on your cameras. Guys, can you hope you all can hear me and see me? This is a marking scheme where long cases exams marking scheme where like these are the marks these students got during the final MBBS exams initially, right? So the local grades, the Colombo faculty. So just I'm showing you also the final marks 40, 50, 55, 40, right? Even though they are these so you can see the remarks I have mentioned, these discussion and average knowledge, extremely poor discussion, right? Like that. So here then finally me and the other consultant we decide somehow like to give marks and we change these things and we wanted to pass final exam. So then of course you can see right final MBBS examination. So then we increase the marks, right? Somehow give pana then but here you can see last time students who came for the long cases exam. So there are a lot of students out there who had 88, 92, right? Then 78, 66, 80, 86, right? So here the important message is you might think like apitna clinical exposure can have, right? These local grads they are getting the clinical exposure. So here the important message is the clinical exposure led to adipura දෙකකින් ලකුණු හම්බෙන්නේ නැහැ. එහෙනම් වාට්ටු ඉන්න ඇටෙන්ඩන්ට් එකනේ වැඩිම පුළුවන් වෙන්න ඕනේ. එයා තමයි ලෙඩ් වැඩිම දකින්නේ. ඊළඟට නර්සස් ලා. අන්තිමටම තමයි කන්සල්ටන්ට් දකින්නේ. අඩුවෙන්. නේද? Why? The reason is that it's always about the knowledge. So if you have a very good knowledge and if you know the facts, related relevant facts, you can apply it to the patients and you can, right? That is the most important thing. So make sure you have got perfect in these theory facts. And short cases we just started. So just started. So there are so many tricks and so many things you need to learn. GI, CNS and everything, right? So the CES is important. So you like now you can see like how easy it is. Now හිතුවේවත් නැති දේවල්නේ ගොඩක් දෙනෙක්, right? කලින් join වෙලා මොකද නැති අය හිතපුවත් නැති දේවල්. එකපාර කොහොමද ටක් ගාලා patient කෙනෙක් ටක් ගාලා exclude කරගෙන මේකට එන විදිය. Right? ටක් ගාලා. So how easy it is. So in abdomen, how, right? You will understand everything. So the complete diagnosis, the presentation, everything you will get perfect in all aspects, right? So good. So we'll move to the next important one. So then guys, so precordial examination. So there are important 5 components are there which you need to know under precordial examination, which you need to comment about precordial examination. So what are the 5 components? So I think Baba Kapu diha balapon balan one karna pahat තියෙනවා. So one of the most important thing is guys, but surgical scars. That is very important. Surgical scars, right? Then they can have visible pulsations. They can have precordial bulging, right? They can have chest wall deformity, and they can have signs of respiratory distress. Surgical scars, visible pulsations, precordial bulging, right? Then chest wall deformities and signs of respiratory distress. So surgical scars, visible pulsations, precordial bulging, chest wall deformities and signs of respiratory distress. But here the one of the most important things, surgical scars. So here important surgical scars are there. So you might find midline sternotomy scar. එකක් තමයි midline sternotomy scar එකක් දකින්න පුළුවන්. ඒ කියන්නේ මැද්දෙන් එන්න මෙහෙම පළල. Then some patients you might notice a thoracotomy scar. Thoracotomy කියන්නේ මොකද? පැත්තෙන් පළල තියෙන එකක්. side එකෙන් thorax එකෙන් මේ පැත්තකින් පළල තියෙන එකක්. Maybe thorax එකේ තමයි පළල තියෙන්නේ. It can be in the lateral or maybe in the infrascapular region. Scapula එකට පළලෙන් thorax එකේ කපලා තියෙන සුළු. නැත්නම් මේ පැත්තෙන් lateral කපලා තියෙන සුළු. ID is okay. So here the important message is, guys, right? So related to your exam. So if you notice a midline sternotomy scar, midline sternotomy means like it can be anything. So only surgery එකක් කරන්න heart surgery එකට හොඳට open කරලා ලොකු surgery එකක් කරනවා නම් they open the thorax. So mechanical access වෙන එක ගොඩක් වෙලට easy. Like 90% of the time it's easy to access from the midline by putting a midline thoracotomy scar. So thoracotomy is the easiest way. So methylene පළල තියෙනවා. So ඒක මහද්දි තමයි midline sternotomy scar එක දකින්න. So it could be anything, right? So but if they have undergone an surgery, complete surgery, will you be able to hear a murmur? No. And murmur එකක් ඇහෙන්න බෑනේ. Surgery කරලා. So then guys, right? So if you notice a midline sternotomy scar, on top of that, if you can hear a murmur, so there are a few possibilities are there. You hardly get, but there are possibilities are there. One thing is, right? You will learn. I will come to that later, right? So if you notice a midline sternotomy scar at the moment, just know it could be anything. Whenever surgery comes, but if you notice a lateral thoracotomy scar, thorax in the so most of the time, you get the access from the lateral thorax to ligate the PDA. PDA එකක් ligate කරන්න මෙහෙම එන්න පුළුවන්. So it can be a ligation of PDA. But so if you ligate the PDA, usually you will be able to hear a murmur. PDA එක close කරාට පස්සේ ඔයාලට murmur එකක් ඇහෙනවද? සාමාන්‍යයෙන් නැහැ. Good word, man. If I can thoracotomy scar එකක් දැක්කොත් PDA එකක් වෙන්න තියෙන chance එක අඩුයි. මොකද ඒක ligate කරලා නැතුව මම එකක් ඇහෙන්න බෑ. If you notice a thoracotomy scar and still if you can hear a murmur, prominent murmur, what could be? මොකද්ද ඒක most likely condition? Thoracotomy scar එකක් තියෙනවා. හොඳ murmur එකක් ඇහෙනවා prominent. What could be most likely? ඔයගොල්ලන්ගේ exam එකේ almost always දකින්න condition එක මොකක්ද? It is quite common in your exam. What do you think? Anyone?
So they have done a PA banding.
PA banding, usually PA banding you need to like put a band around the pulmonary artery, so which requires a sternotomy. Sternum එක පළලා මේව කරලා තමයි open කරන්නේ. So PA banding එකක් තිබ්බොත් ඔයා sternotomy scar එකක් තමයි දකින්නේ. දැන් thoracotomy scar එකක් දකිනවා. murmur එකක් ඇහෙනවා. The prominent murmur එකක් ඇහෙනවා. Like a PDA murmur. Sometimes you might hear. Yes, there. Anyone? Come on, guys. Do some common sense. What could?
Officer.
Ali? Huh? Yes. Who's this?
Tetralogy of Fallot. In TOEFL,
Tetralogy of Fallot. How it is possible?
When we put a BT shunt, it can be controlled.
Very good. Yeah, guys, talk children as a palliative surgery. Sometimes we put a BT shunt. So if you talk with the BT shunt, you might see a thoracotomy, lateral thoracotomy, අමතක කරන්නේ midline sternotomy එකක් කාටවත් පේන්නේ නැතුව තියෙනවද? Usually you can see, pulmonary scar එකක් තියෙනවනේ. But the thoracotomy scar, it is there in the infrascapular ගොඩක් scapula එක පිටිපස්සේ තියෙන. So you will not see. If you miss that, the thing is when you insert the BT shunt, it is very difficult to appreciate the clubbing and cyanosis also. Then you might miss you might not be able to detect the condition. So it is extremely important. You raise the hand, turn the child, and you look at the infrascapular region. So whether there is a scar or not. If you notice an infrascapular thoracotomy scar, and if you can hear a murmur, it is nothing else in your exams that is tetralogy of Fallot who has undergone an palliative surgery, that is a BT shunt. Tetralogy of Fallot with a BT shunt. Sometimes the pallor, plethora, or clubbing might not be so prominent, right? So that is very important. So top with a BT shunt, top with a BT shunt, top with a BT shunt. So surgical scar, you can see midline sternotomy, right? But more importantly, focus on lateral thoracotomy, where you frequently get in your exams. Good. So that is the most important thing what I wanted to highlight. Then guys, what? So visible pulsation, precordial bulging, chest wall deformity, right? So you hardly see visible pulsation, but if you notice, you can comment. Usually, you will see in a condition where you will there's a left ventricular hypertrophy, and precordial bulging. You commonly notice a condition where you will find right ventricular hypertrophy. So then. Right, hi, right. So, Anutri Lianage, so tell me, out of these four conditions, in what condition, what are the conditions where you will notice right ventricular hypertrophy?
ASD. ASD.
Okay, ASD usually right ventricular dilatation. Okay, then right ventricular hypertrophy.
In tough.
Very good, excellent. So tell me, what are the conditions where you will commonly hear? What are the conditions where you might hear a loud second heart sound?
VSD.
Thanks.
ASD also.
Yeah. So, what are the conditions where you will find significant respiratory distress? Some child might notice tachypnea, hypoxic subclassical recession.
Tough.
What are the conditions where මං හරි කිව්වේ නැහැ ආ මං ඇහුවා විතරයි කවුරුත් ලියාගන්න එපා. What are the conditions where you will find displaced apex?
VSD.
Okay. Anything else? Any other kind?
PDA also.
Okay. So here the important message is guys, right? So here important message I think most of you all have a little bit poor knowledge about these heart lesions and everything. So I will quickly remind, quickly tell you all how it happens. So then, of course, you will be able to work out and get the right, come to the conclusion easy. So, guys, so first of all, I will quickly tell you all about the VSD. So, VSD is about the ventricular septal defect, right? So, there is a defect in the ventricles. Ventricles දෙක අතර තමයි defect එක තියෙන්නේ. So here the important thing is students, these left ventricle in systole, the pressure is very high, it's about 100. You don't need to know the value. But the right ventricle is around 25 during systole. So during systole, that means during the ventricular contraction, so the significant pressure gradient will be there, and a significant amount of blood will pass through this septal defect, right? So during diastolic, ventricle like a relaxation, so the pressure will in the left ventricle is 0 and the right ventricle also 0. So pressure again. So there won't be any pressure gradient. So there won't be any shunting during the diastolic. So the systolic after during systole only you will notice shunting from left to right, but diastolic you will not hear. There won't be any shunt. So you will hear the high flow moves through a narrow canal. You will hear a murmur, and the murmur will be hand systolic, because during ventricular contraction, it will go throughout, but not during diastolic. So you will hear a hand systolic murmur. So he the මෙන්න මෙතනින් චුට්ටක් උඩින් තමයි හැන්නේ left lower sternal edge එකට උඩින් in the left lower sternal edge. So you will hear a pan-systolic murmur, left lower sternal edge, ඕක වතුර වගේ ඔළුවේ තියෙන්න ඕනේ. Then guys, if you keep your hand, if you keep your hand, right? So sometimes like the thing is, if you keep your hand on left lower sternal edge, you keep your fingertips or the palm about it. So when you keep it, sometimes you might be able to palpate a palpable murmur. So what does that think? So you call it as a thrill, right? Hand systolic murmur with left lower sternal edge. In addition to that, you will feel a thrill over the left lower sternal edge. That is the most important sign which you need to identify in your inner child with a VSD. If you notice these two things, it's nothing else that's about VSD. But here, one of the important messages, guys, you need to have an idea about what happens, then you will be able to work out everything. So during ventricular contraction, so can you comment about the pulmonary valves and the aortic valves? Will it be in a closed position or in an open position? Ventricles they contracted, so it should be open. These valves should be open during the ventricular contraction. So during ventricular contraction, so will there any space in the right ventricle? Blood method the right ventricle accumulate to another man. So when it contracts, all these blood will move the pulmonary artery. Right? So when it goes to the pulmonary artery, when the significant amount of blood goes through the pulmonary artery, what will happen? Pulmonary valves get thicken, and the problem, what will you notice? They will develop pulmonary hypertension. That means, guys, what? So pulmonary valves get thick, and the pulmonary pressures goes up. Pulmonary pressure එක වැඩි වෙනවා කියන්නේ මොකද්ද තමයි? So diastole එකේදී මොකද්ද වෙන්නේ? Pulmonary valve එක සාමාන්‍ය විදිහට වැහෙන්නේ නැහැ. මෙතන pressure එක වැඩිද? ටොං ගාලා හයියෙන් වැහෙනවා. Will close with a very high force. Tong. So what will you notice? So if they develop pulmonary hypertension, you will notice a loud second heart sound. That is the classic thing which you will notice. So after some time, so the pulmonary hypertension become more and more severe. You will be able to hear in addition to the loud second heart sound, you will be able to palpate the second heart sound as well. So if you keep in your hand over the pulmonary area, that is the left second intercostal space, you will be able to palpate the second heart sound. That indicates what? So child is having severe pulmonary hypertension. So the mild to moderate pulmonary hypertension, you will be able to hear the second heart sound, and in severe pulmonary hypertension, you will be able to palpate the second heart sound as well. So when large amount of blood goes through these pulmonary arteries, So the thing is, here it will come to the left side of the heart, right? So then, guys, so the left side of the heart will collect more and more blood, so that there will be a left ventricular blood accumulation will be there. More and more blood will accumulate over the left ventricle. Like right පැත්තෙන් ආපු මේ ඔක්කොම ටික left පැත්තටම ආය යනවා. So what will happen? The left ventricle gets dilated, 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 and dilated. So make a look යනවා. ලොකු වුණාම මොකද වෙන්නේ? Heart will not be able to pump properly. So the children can have cardiomegaly as well as heart failure. Heart එක ලොකු වෙනවා. ඒ වගේම heart එක fail වෙනවා. So if the heart gets enlarged or dilated, what will you notice? So if you keep your hand, sometimes you might be able to visualize there is a pulsation over the apex. Apex එක ගහනවා දකින්න පුළුවන් සමහර බබාලගේ. So we call it as visible pulsations over the apex. So if the cardiomegaly is there, you might be able to right? Not always. Cardiomegaly, the visible pulsation. And in addition to that, if you keep your hand over the apex, then you might be able to detect that it is not in the left mid clavicular line, second into the fourth intercostal space. It must have got this place. So the thing is that you will be able to feel a displaced apex. Apex එක මොකද වෙන්නේ? එහාට තල්ලු වෙලා feel වෙනවා. වැඩිලිසිද? So cardiomegaly එකක් left ventricular dilatation එකක් කියලා indicate වෙන්නේ මොකද්ද? The apex will be displaced. So in aortic stenosis, in hypertension, the thing is here they will develop they will be a pressure overload rather than the volume overload. Aortic stenosis එකකින් මේ aorta එක stenosis වෙලා. එහෙම වුණොත් තමයි adult medicine වල ඔයගොල්ලෝ ගොඩක් වෙලා ඉගෙන you will learn more in your adult medicine. So heart is they will make pressure overload. So what happens is the heart muscles will get hypertrophied and it will be very thickened. But in VSD, MR or PDA, you notice there won't be the pressure overload. Maybe when the blood will accumulate, there will be a volume overload. So there will be a dilatation rather than hypertrophy. So the both conditions, the apex can get displaced, but the dilatation, it will be more displaced. And in addition to that, the feeling will be different. So in a hypertrophy, they will get force display. After forcefully make pressure එකකින් තල්ලු වෙනවා වගේ තේරෙනවා. But when you keep when you palpate the apex in a condition with a left ventricular dilatation, you will feel something different. මේක හරියට ඉච්චර තදින් forcefully තල්ලු වෙන්නේ නැහැ. ඒක බැලුමක් නිකන් එක පැත්තක තියලා එක පැත්තකින් තද කරලා ලාවට මෙහෙම ඈත් වෙන්නේ. Something like that. So in a hypertrophy, the forceful push, අප හොඳට push කරනවා forcefully, right? ඒකට අපි මොකක්ද කියන්නේ? Heaving apex. හැබැයි අත volume overload එකක මේ forcefully නෑ. හැබැයි තල්ලු වෙන එකට අපි කියනවා thrusting apex. So thrusting apex occurs due to volume overload. Heaving apex occurs due to pressure overload. In pediatric setup, do you get a condition with an heaving apex? No. You always get a apex, displaced apex is the thrusting apex if they develop cardiomegaly complication. Cardiomegaly is a complication. It can develop thrusting එකක් තමයි දැන්. So ඔයගොල්ලෝ heaving කතාවක් ආයේ PD වලදී ඔළුවට ගන්න ඕනද? It's always about thrusting. Exam එකේ aortic stenosis දෙනවද pediatric වල? නැහැ. හරිද? එහෙම ළමයි මට ක්ලාස් එක කම්ප්ලිකේට් කරන්න පුළුවන්. ඔය වැල් වට අරන් ගන්නල මගේ දන්න දැනුම ඔක්කොම ඔයගලන්ට කොහොන් එහෙමද නෑ ඒක අවශ්‍ය නෑ. One good house offices. What is the commonest congenital heart defect? ESD. Second common? ESD. Then our neonatal early infancy PDA also not uncommon. Then guys, commonest congenital cyanotic heart defect in infant, right? Right? What is it? Bigger children, tetralogy of Fallot. Those are emergencies for most of the time. So they what the TG transmission of the artery component? So we give the common one, right? So you want good house officers, so whether you have enough skills to detect those conditions, that's all. Right? Good. So that is what happens, right? So that trusting apex with the displaced apex, you will notice in VSDs. Right? So as I mentioned, after sometimes the heart might not be able to pump forcefully, so they can have heart failure. So left ventricle like initially fail when the right ventricle like fail when. So when they develop left ventricular failure, so what happens is more and more blood will get accumulated in the lungs. So you will be able to hear a fine crepitate bilateral fine creps in when they develop heart fine creps, because coarse creps can get, you will hear in commonly you will hear in respiratory tract infection, right? The fine creps are my heart failure. Then guys, what at the same time once they are soon like these right ventricular failure also goes in hand, so you will be able to feel a hepatomegaly. So sometimes in your exams, so during your discussions, they ask, Uta, what do you think? Now you said you were able to palpate a thrill. Now tell me, is it a slightly small VS? The thrill was so prominent. Or you said it's a loud murmur and there's a thrill also. So tell me, is it a prominent? Is it a small lesion or a large lesion? The subject murmur thrill what do you think, Netwin? Is it a small cardiac lesion or a large one?
Small cardiac.
Small one.
Right? Body size, body size right? So it's like that. So the canal is small, the sound, right? Intensity will be high, right? So you will hear a prominent tone as well as the twin. So another acute systolic murmur will lower the left lower sternal edge. Then high amount of blood flows through the pulmonary artery. So once they develop pulmonary hypertension, you will be able to hear a loud second heart sound and later on palpable second heart sound. So when these blood goes to the left ventricle, left ventricular dilatation occurs. So they will have cardiomegaly. So you will be able to feel a thrusting apex and as well as it will be displaced. So then of course after some time, so the heart can get failed. So then of course bilateral fine threads as well as hepatomegaly will be there. So what we do is guys, so most of the time, what we do is we do the open heart surgery. What we do is like there are several ways out there of management. So if it is a very small VSD, we observe and follow up for the spontaneous closure. If it is a moderate one, we might do a device closure, femoral artery you might not be able to detect like close and exam right? That will be there. If it is a large one, you do a open heart surgery. So where you put a midline sternotomy scar, you open it and you open the heart and you close the VSD. So after doing, after these surgical closures, will you be able to hear a murmur usually? No. Device එකක් හරි මේකක් හරි දාලා තිබ්බොත් ඔයාට murmur එකක් ඇහෙන්නේ නැහැ. Open heart surgery එකක් තිබ්බොත් ඒක midline sternotomy එකක් එක්ක VSD ලාමේදී open heart surgery එකක් කළොත් සාමාන්‍ය murmur එකක් ඇහෙන්නේ නැහැ. But there are exceptions are there. We will discuss those exceptions. You might get in your exams during your these revision and short case online exam, right? අපි කතා කරමු මේ පින්තූරයි ඒවයි ප්‍රොපෝසල් ඒවත් එක්ක ඉන්නවා. ඉගෙනගන්න ඔයගලන්ට basic ටික හරියට ඉගෙන ගන්න අපි advance ඒවට යනවා, right? Then good. Then guys, what? So then guys, the next one is guys what? The ASD. Then you want to open the smart lazy. That part of the day. Now, it's almost same, right? So the ASD, there is a septal delay between the atria, right? The atria is the open velocity. So atrial septum is opening එකක් තියෙනවා. So ostium secundum is the common. So here what happens is, guys, so during systole, the atrial pressure, left atrial pressure during systole is around 25. The right also it is around 25. The diastole it is around 0, and here also it is around 0. The MAR value. So there is no pressure gradient. It is a pressure difference. So systole get pressure difference, diastole get pressure difference. So usually there won't be any. Ideally, you shouldn't have any shunting. But since the left ventricle is thicker compared to the right ventricle, due to the ventricular compliance difference, there will be a mild shunt, large shunt from left to right. From at the atrial level, left ventricle, left atrial, right ventricle level to the blood. මතක තියාගන්න ඕනේ point එක මොකද්ද? වැදගත්ම point එක blood යන්නේ චුට්ටයි. That is the most important message. චුට්ටයි, right? So that is the most important message. So usually these ASDs are comparatively large, defect is large, and a small amount of blood is going to this septal defect. So from here, will you be able to detect the murmur එකක් ඇහෙනවද නැද්ද මෙතන? You will never ever hear a murmur. Got it? Good. Now tell me, now during these atrial contraction or atrial systole, so usually these bicuspids and the mitral valves are open. So the blood will not accumulate in the atrium. So all these blood will flow to the right ventricle, and at that moment the right ventricle is closed. Is a pulmonary arteries. So what will happen? The may acting with blood dawa, so that the blood will get accumulated. The right ventricle, right ventricle. Right. So there will be a right ventricular dilatation. That will be there. Right? So, not the hypertrophy, not only the dilatation. Then guys, so then the ventricles get contract, so we still there will be a blood will flow through this pulmonary valve, to the pulmonary artery. And ventricles, they contract. Now tell me, during the ventricular contractions, right? Okay. Now, the pulmonary blood will flow through this pulmonary valve. So, is this a normal pulmonary valve or an abnormal pulmonary valve? Valve එක defect එකක් තියෙනවද නැද්ද ASD එකේ? නෑ, ASD defect over here. So, it's a normal pulmonary valve. The normal pulmonary valve එකකින් මේ පැත්තේ චූටක් ආපු blood ටික තමයි වැඩිපුර යන්නේ. So, little bit significant, little bit comparatively, little bit larger volume will move through this pulmonary valve. That's all. In the normal valve, you can pick up blood. So sometimes you might be able to hear ejection systolic murmur. The pulmonary area. Pulmonary area is left second intercostal. So here the key important message is, guys. So what the government chuti. What the vachane chuti. Chuti amount So most of the time, the murmur, so because due to that, the murmur intensity will be very minor. Not like the VSD. VSD, you will hear everywhere. But the ASD, it will be very mild most of the time. So it will be ejection systolic murmur in the pulmonary area, like VSD, it's not like that. Something like that. Got it? Medilacida? Right? So here the important message is, guys, also right. So just like the VSD, so large amount of blood will go to the these pulmonary arteries, so they can have pulmonary hypertension, then later on the left ventricular failure. Right, guys. So, guys, the important message is, as I mentioned, small amount or chuti pramana can. So, here the important message is, because due to that, so do they develop early pulmonary hypertension? Do they develop early heart failure? So, practically, when it comes to the cases, practically in an ASD, you will never able to hear a loud second heart sound or a features of heart failure or anything except the mild ejection systolic murmur and some other important way they can write. So completely normal child, no any other peripheral signs, only the auscultatory signs, none of that is ASD. And they clear the So will you be able to notice a precordial bulging? No. Will you be able to feel a parasternal heave? No. Why? The ASD also, the ASD, they won't develop hypertrophy. It's a ventricular dilatation, and also it will be very mild. So the complications develop, and it takes around decades. So 3, 4, 5 decades of maybe afterlife. Developing right? So you also must have an ASD somewhere. You might have, right? So you don't need to worry. They don't develop complications. So here the important thing is, I told you the ejection systolic murmur is very mild. Sometimes it is very difficult to appreciate, right? So sometimes you might be able to detect some other important sign during your auscultation, which give you a better clue for an ASD. So what is that, guys? Left side blood blood down. So the right side, left side comparatively, the right side blood value. So they will give more blood in the right side compared to left. So what happens is, so then the blood accumulating a mixture from right? High level of blood accumulating a VSD is from VSD left from blood accumulating. So when the ventricles get contract, so what happens is all these blood will go out, and during diastole, the valves get closed. But the problem is, it will not close at the same time because the right ventricle now has little bit more blood compared to left. So right ventricle get closed little bit later compared to these left, right? So these pulmonary valve get closed little bit later compared to aortic valve. Pulmonary valve එක චුට්ට පහුවලා තමයි වැහෙන්නේ. ඒක මේ වෙන වෙලාවක් නෙමෙයි. Right? පොඩි change එකක් තියෙනවා. So එහෙනම් මොකද්ද වෙන්නේ? You will hear මොකද්ද වෙන්නේ? Right? So you will notice like there is a change of the sound, right? Of the valve heart sound. So the thing is, guys, what happens is aortic valve gets closed first, then the pulmonary valve. So we call it as split එකක් යනවා. But it's not the physiological split where like which happens only during inspiration. So here you will notice this split throughout. So we call it as fixed split in the pulmonary area. So pulmonary area ke auscultate කරද්දී හොඳට observe කරන split එකක් යනවා split එකක් යනවා. So split කියන්නේ මොකද්ද? ටක් එහෙම නෙමෙයි. Something like that. It's not tuck එහෙම නෙමෙයි. Second heart sound එක beat එක වෙනවා. That's the difference, right? So don't think that it is so prominent one. So you need unless you focus, you will not hear. That is the fixed. So normal child, otherwise no peripheral signs. So only ejection systolic murmur, mild ejection systolic murmur in the pulmonary area and a fixed plate. Nothing else. That is ASD. Then lamai hadisiyath exam එකේ practice කරනවා මර්ම් එකක් ඇහෙන්නේ නැහැ. ළමයා පොඩ්ඩක් ඒරිට බෑ. මර්ම් එක ඇහෙන්නේ නැහැ. ඒ කියන්නේ 100 මේව ඔයාලට දැන් මර්ම් එකක් අහන්න හම්බුන්නේ නැහැ. මොකද එක්සෑම් එකේ කේස් එක yes. හැබැයි මෙහෙම මර්මස් මුකුත්ම හුරු නැති කොහිදවත් නැති ළමයට මේ VSD එකක් ඇහෙන්නේ නැති වෙන්නත් පුළුවන්. සාමාන්‍ය මොකක් හරි අහලා ගොනු. So that is about ASD because in a ward setup, because we are given a prominent PhDs, right? So it's very easy to find. The ASDs, of course, like the patient, like sometimes මාසෙ දෙකකට විතර කලින් ward එකට admit වුණාම ඔන්න මර්ම් එක ඇහෙනවා. හොඳට. සමහර ඉන්ෆෙක්ෂන් එකත් එක්ක hyperdynamic circulation එකක් එක්ක මේ. අපි මොකද්ද list එකට ගන්නවා ASD එකක් තියෙනවා කියලා. exam එකට කලින් call එකක් දෙනවා. ඉතින් එතකොට ඒ ළමයට ඉන්ෆෙක්ෂන් එකක් නැහැ, hyperdynamic circulation එකක් නැහැ. එතකොට ASD බබාගේ මර්ම් එක ප්‍රොමිනන්ට් නැහැ, සමහරට ඇහෙන්නේ නැහැ. එහෙම වෙන වෙලාවල් තියෙනවා. those things practically what happens. එතකොට ගෙනාපු ලෙඩ ලෙඩ අඩු වෙනවා මේකව දීලා දාම කියලා ලාවට අපි ලාවට යනවා කියලා කවුරු හරි කිව්වොත් නා දාලා දානවා. ඒක right? Then down that these modes are almost always clear there? Good, easy. Nowadays nothing much, guys, nothing much. Fine, really. So this PDA guys, what there is a patent ductus arteriosus, there is a there's a connection between aorta and the pulmonary artery. Aorta and pulmonary artery. So during systolic, which part aorta pressure it is very, 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 very high. So what will happen during systolic? There will be a left to right shunt, right? There will be a left to right shunt will be there during systolic. Right? There will be a left to right shunt. So the thing is, then diastolic. Again, guys, the aortic pressure is higher compared to pulmonary artery pressure. So what happens is, even during diastolic also, there will be a left to right shunt. Systolic kick it the hand on, diastolic kick it the hand on. So what do you call that? During systolic and diastolic, so it is continuous throughout. So, but it will be going in a very forceful manner in a narrow canal. So you will hear a very, very, very prominent murmur. We call it as a continuous. The murmur is like a machine, something like that. Continuous missionary. Continuous mission. Continuous. continuously, just like machine. Where, what is the side? ළමයි මම මේ ඔයගලන්ට අතවසරේ සෞඛ්‍ය පුතේ පාඩම් විදිහට ligaments කපලා ඇඳලා තියෙන්නේ. So the pulmonary artery is there, so it will be distal. So where? Pulmonary valve එක මෙතන. එතකොට pulmonary valve එකට වඩා චුට්ටක් උඩින්. That is left infraclavicular region. Clavicle එකට චුට්ටක් පල්ලෙන්. Left infraclavicular region. Continuation in the left infraclavicular region. So here the important message is, guys, but most of the time students actually they get confused with the VSD, right? So the main reason is, guys, what? So even though I mentioned there is a pressure difference, during systole the pressure difference is so high. So the intensity during systole is very high. Systole pressure difference is high. Diastole ඊට වඩා ටිකක් අඩුවෙන් තමයි යන්නේ. ඒතකොට සමහර අයට ඇහෙන්නේ systolic part එක විතරයි. So you think it is a pansystolic murmur. So that's why you need to go with the peripheral signs and everything. Fill එක බලන්න ඕනේ අර පැත්තෙන්. High volume bounding pulse, dorsalisity. Otherwise, small kids like what infant කෙනෙක් දෙනවා අවුරුද්දක බබෙක්. It can be a VSD or PDA. මුළු precordium එකේ murmur එක යනවා. ගාලා. හොයාගන්න බෑ කොහෙද locate කරන්නේ. Right? ඒකට ඔයා දෙකම pansystolic වගේ හැන්න පුළුවන්. but diastolic component එක සමහර අයට ඇහෙන්නේ නැති වෙන්න පුළුවන්. So you need to, that's why the peripheral signs are also important, right? So go assess those things there. So just like the VSD, ඉතුරු ටික මොකක්ද වෙන්නලා මේ ECG isn't it easy? So මේ පැත්තට වැඩිපුර blood, so lot of blood will go through this pulmonary artery, so they can have pulmonary hypertension. So you just like the VSD, you can hear it. Might be able to hear a loud second heart sound as well as later on palpable second heart sound. So then, of course, guys, what lot of blood will go into the left side, and there will be a left ventricular dilatation. Just like the VSD, there will be a thrusting apex with a displaced apex. So just like the VSD, they can have heart failure. So you might be able to hear a bilateral fine crest and the tender hepatomegaly. At the same time, guys, what? That's all. Right? So here the important message is, guys, what? So PDA, the surgical closure, again, you can do it, you can do the device closure, but the other important thing is if it is a large one, so you can do the open heart surgery. But the important message is, guys, what? So PDA it is not inside the heart. So where heart එක open කරන්න ඕනේ නැහැ. ඔයා thorax එක open කරපුවාම ඇති. So you don't need to open the heart. So you can do the surgery, early surgery, and it is not sort of big surgery. So you can access these patent ductors from the putting a lateral thoracotomy. මෙතනින් cut එකක් දාලා මොකද කරන්නේ? Ligate කරන්න. Right? But once you ligate it, you will not hear a murmur. Usually. So lateral thoracotomy තියෙන්න පුළුවන් possibilities මොනවද? එකක් තමයි PDA and other one is top with the BT shunt. But you will hear a scar and a murmur, you will notice is BT shunt. Right? So the final one. After. So tetralogy of Fallot. So tetra means what? There are four lesions are there, right? So what are the four lesions? So they will have pulmonary stenosis. Then they will have a large VSD. So pulmonary stenosis and the large VSD. So when there is a pulmonary stenosis, what will happen? So there will be a pressure overload. So the third feature is they will have associated right ventricular hypertrophy. The fourth one is overriding aorta, which it is not so clinically insignificant. So pulmonary stenosis, large VSD. VSD නෙමෙයි large VSD, and right ventricular hypertrophy. Now tell me, guys, Okay. So, histology of palate. So, at where they will be most of the time asymptomatic, and the pulmonary stenosis, like pulmonary stenosis with time. So, they develop all these symptoms. So, when the pulmonary stenosis is there, so the right ventricular pressure sometimes can exceed the right ventricular pressure will exceed the left ventricular pressure. Pressure එක වැඩි වෙනවා වම් පැත්තට වඩා. So what happens is they will be a right to left shunt, right to left shunt, right to left. Right? So what will you notice? All these deoxygenated blood that's moving from right to left. From පැත්තෙන් දකුණු පැත්තෙන් වම් පැත්තට යන deoxygenated blood. So deoxygenated blood what will happen? So they will have cyanide. And also with the hypoxic state, the erythropoid, they will be more and more erythropoid secretion. So they will have plethora. At the same time, the clubbing also occurs due to that. So here the one of the important messages I told you now with the pressure overload, there will be a right ventricular hypertrophy. දකුණු පැත්ත hypertrophy වෙනවා. දැන් muscular වැඩි. Sometimes some children you might not be able to detect in most of the kids, but some kids you might be able to notice a precordial bulging. මොකද right ventricle එක තියෙන sternum එක යට. එතකොට sternum එක මෙහෙම ඉස්සිලා වගේ පේන්න පුළුවන්. We call it as precordial bulging. The other important message is, guys, what sometimes when you keep your hand over the chest, so the veins, right? Forcefully, what we call that? The parasternal heave. So when you keep your hand, you might be able to feel the parasternal heave as well as the prominent. You inspect, sometimes you might be able to detect a precordial bulging. So here the important message is, guys, now there is an obvious pulmonary stenosis. So when the ventricles get contract, මේ පැත්තට blood ගියාට මේ පැත්තට යනවා පොඩි volume එක. Small volume goes through this. They try to push, but since they are unable, so a significant amount moves this side. But the forcefully some amount will go through this narrow pulmonary valve. So for the veins, then of course you will hear and you will hear ejection systolic murmur. So, guys, now what is the important next thing? Now my මතක තියාගන්න pulmonary ඇල්ලට artery එකට blood අඩුවෙන් ගියාම මොකද වෙන්නේ? They won't be like they don't develop pulmonary hypertension. There will be shrinkage of the blood vessels. මේවා ටික narrow වෙනවා, පණ නැති වෙනවා. ඒකට මොකද වෙන්නේ? Pulmonary pressure එක it will be low, less compared to even for normal. එහෙමනම් මොකද? මේක during diastole there will be a minimum pressure. මේක තල්ලු කරන්නේ නැහැ pulmonary valve එක උඩට තල්ලු කරන්නේ නැහැ forcefully. එහෙනම් මොකද වෙන්නේ? You will hear soft second heart sound, soft second heart. So second heart sound occurs with the closure of the pulmonary valve and the aortic valve. So where may pulmonary valve without auscultate current, you will hear a ejection systolic murmur and the soft second. Clear? Yes. Easy? Easy. Right? So guys, you all have a medicine class at 12:30. Class. Okay, right, good, great. So here, guys, this is an introduction, but I think most of the students actually they joined and they registered to be short courses even before that, just after that exam. Yeah. So most of the students actually they have started covering and they have started listening to those lectures. So you all, again, those who couldn't join these lectures and try to cover the things. This is just an introduction, right? Everything, but don't count it as an I did the very first class. So however things, right? Everything will be there. So this is the initial thing to brush off everything, as well as to give you the plan of this time VIVA course. Right? Then go that the VIVA course plan so that is important. So however the things early as possible, get perfect, and tomorrow onwards try to practice. So every day you can call me and you can practice, right? You can drop me a WhatsApp message and I will give you a time. You can call me and practice long cases and even the short cases presentation, everything. Then cover these things, then join these short cases online exams and the revision. And I might conduct a long cases pre-session, but otherwise I will give you the platform access. Cover the things, then come to the hospital and get perfect. So then, of course, these other practicals and everything, you will get perfect, right? So this time I'm doing this as soon as like 2 weeks. I'm giving you only 2 weeks to cover this CVS and CNS, then doing the online session, then doing these specialized unit CVS and CNS practical, right? ඒකට එන්න මේක වැදගත් overall cases CNS cases or CP cases 8ක් විතර තියෙනවා. right? I took plus 15ක් විතර තියෙනවා. trisomy and බබාල ඉන්නවා 5 නෙමෙයි 10ක් විතර ඉන්නවා. ඔය හැමදේම තියෙනවා, right? ඉතින් you will see like lot of CNS and CNS cases. So in addition to that, hospital also, if you are confident, if you have covered early, I will help, right? So cover the things early as possible. Don't wait till the very last moment, and it will be beneficial for other subjects as well, right? So I don't think you will get a training. I don't know. Probably will not. I don't think you will get a training like this, right? So okay, good. So here, hope you had a clear idea. So join these classes and cover the things early as possible. So if you find any doubts, I'm giving you a platform also, since we have limited time for this time VIVA, right? The August is like, we don't have like practicals, everything, those subjects, it's not easy, right? So use the platform, cover things early as possible, and join these exams and make sure you have got perfect, right? Whether you are confident. So guys, hope you had a clear idea. So then, if you have any questions, you can stay and ask. Or otherwise you can join your medicine class. So then, see you guys. Have a nice day.
So excuse me, I have a question.
Yes, Amaya.
Sir, when we start the examination, if the child is settled down and all that, can we start with the auscultations in CVS?
Yes. You will learn all these things with time. Everything is there in lectures. But anyway, I will tell you all. So here the CVS and respiratory, it is a big share, not like adults. Adults, of course, you can go according to the order. But pediatrics, of course, most of the time, like child might not be right cooperative. Sometimes trisomy children might not allow you to examine and everything. So you need to medicine. So you need to use all your tactics. So here one of the important thing is auscultate karadi stethoscope. So always try to get at the beginning, try to make sure whether the child is calm or not. So make sure if it is a very small kid or a trisomy child, try to occupy their hands. Age appropriate toy. So they will be occupied with the hand and they will enjoy. Even like ඒක පටන් ගත්තත් දැන් ගිහිලා අහෙන් යද්දාම මේව කරපුවාම කරන්න බෑ. එයා මොන හරි වෙලාවක අඬනවා. ඒක ඔයාලගේ main physical sign එක මොකද්ද? Diagnosis එකට clues දෙන. It's the auscultation. RS auscultation. GI palpation of the liver and spleen. Right? So then you need to start with that. ඒක කරාට පස්සේ ඕනේ මොකක් කරත් ඕනේ. මොකද ඇඬුවොත් auscultation එකේ ඇහෙනවද නැහැ. abdomen එකේ liver muscles tense වෙනවා. abdomen එකේ එකක්වත් palpate වෙනවද නැහැ. You will not be able to palpate. So you try to do that, then you can auscultate. Just in case when you auscultate at the beginning, sometimes children might cry. Children can get irritated. එතකොට මොකද්ද කරන්නේ? You try ask the mother to calm the child and you try to come from the behind. Strange anxiety can be there. Try to ask her. එහෙමත් අඬන්න පුළුවන්. එහෙම try කරන්න. ඒකත් බැරි වුණොත් මොකද්ද කරන්නේ? You ask mother to feed the child.
Yes.
ඉරි ටිකක් දෙන්න කියනවා. ඉරි දෙන්න කියලා you again start with the auscultation and everything. Then you do the rest of the things. ඔයාලට පුළුවන් ටික බලාගෙන යනවා. ඒතකොට පිළිවෙල නැහැ. toe clubbing and cyanosis බැලුවා. ඊපස්සේ auscultate කරා. right? pulse එක බැලුවා. right? dorsal speed බැලුවා. පුළුවන් ඒවා ගිහලා ඊට පස්සේ තමයි right? back එකේ auscultate කරා. ඊපස්සේ පුළුවන් ටික ගිහලා ආය අම්මට ඇඳෙන්න කියනවා. ආය ගන්න කියනවා. right? so it doesn't matter. right? you will understand. ඒකට තමයි සමහර වෙලාවට practically මම ඉස්සරහා short cases කරන එක වැදගත් වෙන්නේ. මොකද මේ situation එක tackle කරන එක. situation එක tackle කරන එක. like නැත්තම් medicine වගේම ධම්ම එකක් එක්ක කරන්න පුළුවන්. ඔය situations tackle කරන එක මේ. ඒක හොඳට ඔළුවට අරගෙන tackle කරොත් ඔයාලට පුළුවන්. right?
So also, if we get a patient, like a baby, if the baby is dressed, and can we auscultate over the clothes, or like if we undress the patient, sir, then again the baby might.
Yeah. So,
No, sir. What I meant to say, sorry, sir. What I meant is just at the beginning, sir. Can we just, for the sake of auscult over the clothes, and then to properly undress, and then again.
Yes. That is, yes. You can start. You can auscultate over the clothes at the beginning. At the same time, because we don't like if you just auscultate over the clothes. So you can start that. Then of course you can ask mother to remove. අම්මා ගලවද්දි ගොඩක් වෙලට අඬන්නේ නැහැ. ඔයගොල්ලන්ට බබාලා හදලා නැහැ තාම මෙච්චර එක්ස්පීරියන්ස් උත් නැහැ. අම්මා එක මේවා කරද්දී ප්‍රශ්න නැහැ. අම්මා ගලවලා මේවා කරනවා. So then you can start the auscultation.
Okay, sir. Thank you, sir.
Any other questions, guys? Very good, right? That is very good. Those are very practical problems you find in examination. Yes. Any question? Yes, Sally. Excuse me. Yes, Kasun.
Sir, another question. Is it okay to examine the child while on the mother's lap, sir, if the child is more comfortable there?
Of course.
We don't have to.
No. That's why the pediatrics ඒකයි ළමයි ඔය pediatrics වල මේක ගොඩක් අය හිතන්නේ අර ඇඳට දැම්ම routine කරනවා ඒකයි මම කියන්නේ ඔය examination technique කියන එක හරියන්නේ නැහැ. You can't apply those techniques to these kids now, most of the kids. So if the child is uncomfortable with the mother's lap, you examine. Then after doing everything, you put the child on the bed and you palpate the liver and the remaining things, rest of the things. Yes.
So the abdominal examination, it's difficult to do on the mother's lap, though. Do we have to?
Abdominal examination, you need to start like you need to keep the child on the bed, right? Without that, you can. එහෙම වුණත් ඒ බබා ඉරිටබල්නේ අම්මට නැමිලා කිරි දෙන්න කියන්න පුළුවන්. Most of the time what we do is we give some chloral before your exams to the child in abdomen case. Chloral කියන සෙඩිව් වෙන එක. Right? බබා එතකොට නිදාගෙන වගේ නම් you don't give, usually we don't give for serious and RS cases, but abdomen sometimes we give.
Thank you, sir.
Okay. So anyway, the examiner will be there. So they always assess how you like tackling those situations. By පැත්තකට වෙලා ඉන්නවද මූණ බලන් ඉන්නවද එහෙමද නැත්නම් හැක්කුලේ යනවාද කියලා. right? ඔක තමයි ස්මාර්ට් කියන එක පෙන්වන්නේ. බය ගොඩක් බබා candidates ලා බය වෙලා බලාගෙන ඉන්නවනේ. එහෙම කරපුවම ලකුණු හම්බෙන්නේ නැහැ. කවුරු හරි එක්කෙනෙක් ටක් ගාලා මේවා කරගෙන යන්නේ. Precautions ගන්නේ ලකුණු හොෝ ගාලා හම්බෙන්නේ. ඒක තමයි classes distinction හම්බෙන්නේ.
Sir, sorry, another question.
Yeah.
Sir, during the examination, if the child wants to go to the washroom, I think some seniors had that experience, sir. Like during the examination time period, the child wanted to go to the washroom, sir. So humanly, we should let them go, but it's our time. So how do we?
So the examiners are next to you, no. So if the patient says he or she wants to go to the toilet, we give the next case, another case. But during the long case, of course, like we will give you more time, little bit more time.
Okay. Okay. Thank you.
එහෙම මොකොත් වෙන්නේ නැහැ. එක එක ඒවා කියනවා නේද? ඒ ෆේල් වෙන්න සාධාරණීකරණය කරනවා. එච්චරයි. හදිසියක් ෆේල් වුණොත් මම ෆේල් වුණේ මෙන්න මේ හේතු හින්දා කියලා කලින්ම කියලා තියෙනවා. නැත්නම් එක්සෑම්ස් වල එහෙම unfair business එකක් නැහැ. very fair. අපි හැම වෙලේම පොඩ්ඩක් හරි කතා කරොත් පාස් කරනවා. පොඩ්ඩක් හරි කිව්වොත්. ඒ කවුරුහරි ෆේල් වෙනවා නම් වාගේ සීනියර් කෙනෙක් ෆේල් වෙනවා නම් මොනවා හරි සබ්ජෙක්ට් එකක ඒ සබ්ජෙක්ට් එක යා එක්ස්ට්‍රීම්ලි වීක්. නැත්නම් ෆේල් වෙන්නේ නැහැ. ඒ කියන්නේ ඒ කේස් එකක් හොඳටම නාලා. හොඳටම නාපුවාම තමයි ෆේල් වෙන්නේ. What I have seen is even like last time එහෙම කියන්න මේවා not because they are not bright, right? the මගේ හිතුව bright ම ගොඩක් ළමයි හිටියා. අවුරුද්දෙන් වෙනවා they get failed in medicine. Right? ඒක මම දකින්න දෙයක්. එතකොට even last time also that happens. I think when I asked the things, what did you say, what did they ask, everything, they were telling, ඒගොල්ලෝ කියන උත්තර අපි බලාපොරොත්තු වෙන දේවල් නෙමෙයි. අපි බලාපොරොත්තු වෙන දේවල් කිව්වේ නැත්තම් ඉතින් අනිත් subjects වලත් එහෙමයි. මම because I have taught, previously I taught all the subjects, so I am well aware about what is necessary and what is not, what are the expectations. I have been working on like the main teaching hospitals now, like throughout Prague, Japura, ගම්පා විතර එකපාරක් ගිහින් ඒක ඔතන මම ඔය exams ගැන හොඳටම දන්න හැම subject එකම expect කරන දේ කියන්නේ නැත්තම් තේරෙන්නේ. ඒක ළමයාගේ වැරද්ද නෙමෙයි. So make sure like you learn the things with the correct things. Like, so I can remember when telling DDs and everything, some students they say මම යහපොන්න එක girl කෙනෙක්ගෙන් ආව bright ම ළමෙක් මට හිතුවා ළමෙක්. What was your medicine case? He said edema. Edema is not a case. Just a sign. Symptom. Right? ගොඩක් වෙලට it's අර Colombo faculty එක සමහර teachers ලා තුගන්න shortness of breath, long case. Long case edema. මම උගන්වන්නේ නැහැ. case එක case fit එකක් කියලා උගන්වන්නේ නැහැ. It is febrile convulsion. Whether it is UTI, whether it is nephrotic, whether it is nephritic. Edema killer nephrotic, the nephrotic and nephrotic. Because your patient has undergone all the investigations and started treatment. So after that, you should be able to. There is nothing called DDs, differential diagnosis. It's always about straightforward diagnosis. Investigations management to compare. It was a nice check. Then she was not sure what was the cause for the edema. Right? She couldn't pick up. So it was a nephrotic adult medicine. Right? You need to evaluate that. You will learn everything and you will get perfect. Any other question? That's good. You should have asked questions during the class, so the others also could have learned. Okay. Yes. Anything else, guys?
Sir, another question. Sorry. Sir, do we get the exam exactly in the ward setting, or are they going to give a separate room with the patient and the bed and
It depends. It depends. Ward setting means like, for example, LRH, we clear a set because we can't like take out these beds and everything now. So we clear a cubicle. Right? LRH, Ragama, api liver cubicle like a clear karna. Make the acute cubicle like a clear karna LRH. Or diarrhea cubicle like a clear karna. Clear karna, patients are doing a cubicle like a clear karna. Ekata dana patients la tika. But I ward set up, everything will be there, right? Cubicle like and the hospital, they do the hospital, they got it. CVS dekai, see abdomen dekai, see norma dala, neonatal miscellaneous things, samahar LR then. But LRH, of course, we don't give neonatal and miscellaneous because LRH, you always try to pass your but Fatty ragam sometimes you get.
So if we like run out of time and we are still in the middle of the examination, should we stop it at that point and go for the discussion, or should we complete it and but we might not have any...
Short cases you need to finish your examination part. So you have 10 minutes. You like within 4 to 5 minutes you will be able to finish, and you will be able to press. That's why you need to practice the presentation. Present karne. So if you have a good practice, you can finish everything within 7 or 8 minutes. Then you will have 2 more minutes for the discussion. You don't need to jump for the discussion, but here the long cases anyway they will rank a bell by 10 minutes. So history to complete කරලා නැත්නම් එතනින් ඉවරයි. Right? සමහර social history අරන් නැහැ, එක එක අරන් නැති අය ඉන්නේ. ඒකට එච්චරයි. ඊට පස්සේ ඉතින් බැනුම් අහන්න තමයි තියෙන්නේ. ඉතින් අරන් නැත්නම් මේ කැලේ component එක නෑ, අර component එක නෑ. So that's why you need to have more training. Yeah.
So is it better to have completed all the components in the long case history and then go back to whatever component we couldn't complete, so that we will get all the marks for the component?
No. Here, one of the important messages, long cases, you will learn when you are listening to these classes. So long cases, we are mainly giving marks for 3 important components. First one is the history of presenting complaint, whether you are evaluating the presenting complaint. Lede edema කිව්වහම edema එක evaluate කරනවාද? EV එක evaluate කරනවාද? Right, cough එක evaluate. That is the first part. ඒකට ලකුණු දෙනවා. Then past medical history if it is relevant. The meningitis pneumonia at past medical history එක වැදගත් නැහැනේ. Now child with a nephrotic child, UTI, epilepsy, then yes, you need to tell about them. Then the social history is the most important. So social history, there are important parts of that. Can't හැමදේම වැල්වට අරන් අහන්න වැඩක් නැහැ. ඇස්ම තියෙන එක්කෙනාගේ කෑම හදන්නේ කවුද කියලා අහලා වැඩක් නැහැ. Is related for diarrhea, right? So there are points are there which you will learn. So you need to cover those 3 components. If you have covered those things, then you're safe. Then you can cover the rest of the things. But conditions like epilepsy, you need to take and neonatal cases, you need to take in detail birth history as well as epilepsy, the developmental also.
Thank you, sir.
Okay. CP also it is same, but CP is not a common case in your exams, right? In your ERPM. It's a common case in your short cases, but not a common case in your long. Anything else? I'm happy to answer your questions, because don't keep any doubts. Clarify those things then and there. You can call me and you can WhatsApp me. And it's always better to ask during the class. Any other question? දැන් මෙහෙමයි ඔයා මාය ඔය අහුව නේද උත්තර ප්‍රශ්න සෙට් එකක්. දැන් ඔයා තියෙන ප්‍රශ්නේ ඔයා අහන්න කලින් මට දැනෙලා තියෙනවා ඔයගලන්ගේ තියෙන ප්‍රශ්න ඔක්කොම. ඒ හැම ප්‍රශ්නෙටම විසඳුත් ඒ කියන්නේ ඔයා කෝස් එක යද්දි හම්බෙනවා. ඔයාට දැන් තව ළමයට හිතෙන්න පුළුවන් මෙයා අහපු ටික මට අවුන්නේ නැද්ද කියලා. එහෙම වෙන්නේ නැහැ. හැමදේම ඔයා ලෙක්චර්ස් කවර් වෙච්ච ගමන් ළමයෙක් ඇඬුවොත් මොකද්ද මේක වුණොත් මොකද්ද එක්සෑම් එක මේවා තිබ්බොත් මොකද්ද introduction to short cases කියන එක මම මේ ටච් කරා විතරයි right. ඒක ලිස්ට් කරපු ගාම ඔයාලට මොනවද patient examiner එකෙන් අහන්න පුළුවන් දේවල් ඔයාලට අහන්න බැරි මොකද්ද මොනවා මිස් වුණොත්ද fail වෙන්නේ ඒ ඔක්කොම දේවල් තියෙනවා introduction to short cases කියන එක right. මොනවද ඔයා highlight වෙන්න ඕනේ ඒවා focus කරන්න ඕනේ everything will be there right. So you will get perfect and don't worry, but clarify those doubts and then and there. And if you cover the things early and if you clarify those doubts, you can come early to the hospitals and you can practice with me more. Next. Anything else? No. Sure. So Ravi, this is the last time, right? You need to switch on your cameras or class name switch on. I don't know whether Ravi can count it, right? Okay. දැන් නෙමෙයි මම කියනවා ක්ලාස් එකේ දෙන්න ඕන් කරලා තිබ්බේ නෑ. මම ආව එළියට දැම්මේ නෑ. අර රාවි කියලා වටනක් දාලා තිබ්බේ. Okay. දැන් ඔය අන්තිමට ඔය ඉතුරු වෙලා ඔය ස්විච් ඔෆ් කරලා කැම් එක තියෙන සමහර වෙලාවට ඊට පස්සේ ඔයගොල්ලෝ ගියාට පස්සේ තේ ළමයි එහෙමම ඉන්නවා. Okay. So hope you had a great time. Hope you learned a lot of things. So then guys, I will see you soon. Okay. So if there's anything, always feel free to call me, talk to me. So then see you guys. Have a nice day.
Thank you, sir.
Okay.
Thank you, sir.